and where you are coming from. Thank you so much once again, and you are very welcome.
Good morning, team. My name is Gideon. I come from Red Cross.
Good morning to you. My name is Atembo Charles. I work for Enzori Rural Health Services.
Yes, good morning. I'm called Charles Mwesije. I work for Foundation for Urban and Rural Development, a local organization that is working in Kasese district. Thank you.
Good morning, ladies and gentlemen. My name is Akro Rose. I work with the Kileme Mines Hospital.
Good morning, ladies and gentlemen. My name is Bomera Richard, Chairperson of the C3 Blame, Chairperson in Nyamwamba Catchment Management Committee, Chairperson BSF Project in the Nyamwamba and the Nyamwamba River, is the Secretary NRM Kasese Municipality. Thank you.
Good morning, everyone. My name is Maska Oliver, Environment Officer, Kasese District Local Government.
Good morning. I'm Vera Morin, the Programs Manager, South Renzori Meza Radio, representing the manager.
Good morning. My name is Gabo Evelyn. I come from Light FM. Thank you.
Good morning, colleagues. I'm Joachim Ku, representing Kasese on the Emergency and Disaster Management Desk. Thank you.
Morning to you all. I'm Kidemba Yopes from Charumba, Center 3, representing HIV, stroke TB.
Morning, Murunga Julius, in charge Charumba Government Health Center 3.
Good morning. My name is Comhand Donna, expert client, Karusandara Health Center 3.
Yes, good morning, friends. My name is Kule Godfrey. I sit on the Red Cross Board in charge of project and program. I also work with Center for Human Life of Prison Initiative Uganda.
Good morning. Good morning. My name is Isaac Mbusa. I work for United Nations Capital Protection Fund. I'm a climate change specialist. I'm based here in Kasese. I support Kasese District Local Government, Kikuve, Hoima, and Chiboka. Thank you.
Good morning. I'm called Bira Veronica, in charge of Karusandara Health Center.
Yes, morning team. I'm Katsume Thaddeus from Planning Unit, Kasese District.
I'm Kundika Solomon. I work with Kode.
Yes, good morning. Wambale Richard, Assistant Engineering Officer, Kasese District, in for the District Engineer.
Good morning, colleagues. My name is Nixon Wampale. I work with Kasese Municipal Health Department. Here in the foot of my boss, who is the Municipal Medical Officer Health Kasese Municipality, Dr. Joy Muhindo. She's not able to be with us this very morning, but she will join us later, I think. Thank you.
My name is Maska Grace from Jarumba PHC, PMI.
I'm called Robert, Assistant in charge of Jarumba Health Center.
Good morning. James Kamuntukachiro. I come from Bar University, Science and Technology. from the grants office. Happy to be here.
Good morning, everyone. I'm Anna Tyler from Bra University of Science and Technology, as a senior finance officer.
Good morning to everyone. My name is Julius and my names. I'm sitting in for the area commissioner at St. John Ambulance, but I also work as the ambulance dispatch officer. Thank you.
Good morning, ladies and gentlemen. Famous Agawa is my name. I work with Bra University of Science and Technology, and for this cause, I'm under Reshape project that is hosting us today. Feel free, and we are grateful for your presence, and we believe that our cause for today will bear fruits. Thank you very much.
Thank you for the speech.
Thank you. My name is Fred Mwebembezi. I work with the Reshape project.
Good morning, everyone. My name is Taro Moses. I work with the Department of Community Health, Bra University of Science and Technology. You are welcome.
I'm Pastor Yusuf. I'm coming from Uhikira, Cultural Institution of Sinkawarenzo. I work as a Minister for Health and Nutrition.
Hello, morning everyone. I'm called Joseph Maseveka. I'm a journalist and I'm from UBC.
Lucas Ron is my name. I work with Glembe Health Center too.
Yes, good morning. I'm called Salitoni. I work with the Mount St. Mary's Hospital as the Deputy Medical Director.
I'm called Tungu Dena, in charge Kilembe Health Center too.
I'm Chikoha Bambari Eric, Community Health Department, and a representative representing the patients attached to Kilembe Mines Hospital.
My name is Baluk Wilson, patients representative from Israel Center 3 under Reshape program.
Yes, morning friends. I am Bagen Sol, representing the manager Adventist World Radio Light FM.
Morning. Good morning, colleagues. I am Edgar Mgema Mlogo. I work with the Department of Community Health in Bra University of Technology. The conveners.
A common goal of environment. You're most welcome, madam. Yeah, so let me get consultations a little bit, and I'll be back to share with you what is coming up next. Thank you so much. I hope you have the program similar to mine.
I would humbly request anybody who is a good volunteer and can connect us to the Lord. You can support us. We have our opening prayer, and then from there we shall give you other information. Thank you. Anybody volunteering to lead us in the prayer? Anybody? Shall we all arise and speak to God? Let's pray. Gracious, loving Heavenly Father, we want to thank you for the gift of a new day and the gift of gathering in one accord. King of glory, we invite you to come and be our ministers, for we know that without you we can't do on our own. King of glory, we pray that you will guide and
umoja wetu ni nguzo yetu, idumu jumuiya yetu.
wish to recognize the Chief Administrative. In the same breath, I wish to recognize my super. Sir, the district health officer, wish to welcome you, but in this, invite you to make a comment on today's function. Thank you, sir.
Yeah, thank you very much, our MC. Our resident district commissioner, chief administrative officer representative, Mbarara University, team that has made us come here tonight, today, invited guests, protocol observed, ladies and gentlemen, I wish to welcome you to today's function, where we are going to have, we are receiving our team from Mbarara University of Science and Technology that has come with a program that is going to help in reshaping Kasese following the disasters we have been having. And our Chief Administrative Officer and RDC tonight, we're here basically to look at the health system's resilience in the context of the extreme weather events. The weather events, like you have been seeing changes in weather in Kasese, have caused a lot of havoc in our communities, where the health systems have been affected. the floods you have been seeing, the drought you see, all that has an effect on the health systems delivery. So we are saying, what can we do? So Mbarara University of Science and Technology came up with a program that we are going to understand in details. How best, a project, how can we do, and what strategies can we put forward to see how best we can solve the health issues in regard to these extreme weather events, and mainly floods that have affected our communities. The university approached the office of the health department, including COW's office, and suggested that we look at the different stakeholders that can come and work with us to lay strategies on how best we can solve the health issues in regard to these extreme weather events that happen continuously in Kasese. In regard to extreme weather events, you will understand the details as we proceed. My work as of now is to welcome you members and say thank you for coming. We shall be here for at least maximum 5 hours. We intend to be here, but this time it shall be done, and our sessions are not so large. But we want to understand and work with you. What do you feel we can do? Put down some issues together with you. Which issues will be put down, known by our RDC and owned by COW as an accounting office of the district, and different stakeholders, and see what can we do in regard to these extreme weather events that occur and what can be done for Kasese. Otherwise, I wish you a good stay and good deliberations when you are around. At this juncture, allow me to invite you, our Chief Administrative Officer, who is our boss in the district, who will later invite the RDC to officially open this meeting. My work was to welcome you and thank you for coming, and I wish you a good deliberations. I remain Wagonza Stephen. I'm the Assistant District Health Officer, Environmental Health, also representing the DHO in this meeting. Thank you so much. Wanakao. Yes. Yes. Now I'm aided by the COW that and the RDC will first have the Dean to give a brief of the details of why they are here, and then they will be able to open the meeting. So can we invite the Dean to come in and have the details of this meeting, and then we shall be able to sit on now to the COW DC. Thank you so much. Professor, thank you for coming.
Thank you, Mr. Bagonza, the RDC, the COW, the DHO, our honored invited guests, participants of this workshop, all protocol observed. Once again, I am Edgar Mugema Mulogo. I work with the Department of Community Health, Mbarara University of Science and Technology. Just a slight correction, I am not the Dean of the Faculty of Medicine. The Dean was here with us yesterday, but he was called for an official engagement. So in the neighboring district of Rubirizi, we thought we would have him online, but we have a technical issue to sort out. Nonetheless, I will provide you with an overview as to why we are here, so that we are all on the same page. We, as Mbarara University Department of Community Health, are conducting a study called Resilience in Health Post-Extreme Weather Events. We like calling it, because that sounds like a mouthful, we like calling it Reshape. So we are here under the Reshape study. Now, how did this Reshape study come about? The Reshape study is a study that was conceived by partners from several countries. These countries include Malawi, Vietnam, Tanzania, and partners from Europe, essentially from the United Kingdom, England. There is a university there called the University of East Anglia. There is Leeds University, and those are part of this study group. So the study, so to speak, is being conducted or implemented in Uganda, Kasese district, in Malawi, the south of Malawi, for those of you who are well informed, has suffered effects of a typhoon that came in from the Indian Ocean and affected the southern part of Malawi. In Tanzania, they have had extreme weather events on the shores of Lake Victoria in the Mwanza region. And in Vietnam, the country is always suffering from typhoons. And because of that, these were the areas that were selected. As you have heard from in bits and pieces, and as you will hear throughout the day, climate change is a reality. It is here with us, and it has resulted in these things that will be explained to you in much more detail, called extreme weather events. Now, extreme weather events affect a number of sectors, but us as public health specialists, the focus is on the health sector. And that is what will be the focus throughout the sessions that are going to be delivered today. Kasese district has bore the brunt of extreme weather events in terms of flooding, and so presents a very good case study for Uganda. This workshop is essentially a workshop at which we are going to do collectively, with the involvement of everybody, information gathering related to the extreme weather events in this district, how those extreme weather events have impacted on the health system at the health facility level, within the communities, and anything related to health service delivery. We will then, once we have had these breakout sessions where information will be shared, we will then reconvene later in the day and develop consensus as to whether these are the actual things that are happening within the district. But why are we doing all this? The expectation is that from this information, we will do, as a team, as a research team, we will do a synthesis of whatever we have found and whatever we have established through other approaches that we have used to gather information on extreme weather events here in the Kasese district. The other approaches are, one, before we actually came to this stage, we have a component across the different partners who are shown there, where we go and look at global literature related to extreme weather events. We then perform what we call a systematic analysis that gives us very good insights on what is happening and how these events have impacted on health systems globally. So once we have that global experience, we tie it in with the information that we have gathered from the representative countries and analyze all this information, and with the outcome eventually supposed to be development of protocols, of tools that can help the healthcare system or the health system become more resilient to extreme weather events. So this workshop is a first step. We will hear from a number of experts in the different components related to extreme weather events, and we will be able to participate and share our own experiences at the different levels of the healthcare system, the health facilities, the community, as you've heard from the introductions. And all this is geared really eventually, once there is an analysis, on developing what we call protocols and tools that can make the health system better prepared when some of these events occur. This is a first workshop that is essential, as we have said, information gathering and consensus, but we expect that when it comes to the time of development of protocols for preparedness, for response, we will reconvene as the people here from whom the information has been gathered, and develop consensus on exactly the protocols and the tools that we will need to make our systems more resilient. So essentially that is what we are here for today. I thank you all for honoring our invitations, and I wish you very fruitful deliberations throughout the day. Thank you very much.
Thank you very much, Professor, for the synopsis about why we are here and the whole background about the Reshape project that is focusing on extreme weather events. Yeah, so my boss, the cow, we have had kind of talk to the team.
Thank you, MC. Yes, good morning, colleagues. Thank you, Professor. I want to take this opportunity to welcome you once again to this engagement, which they have termed Stakeholder Information Gathering Workshop. I want to bring apologies from the Chief Administrative Officer, Mr. Walakira Paul, who has had another engagement with another partner and they have equally gone to the field. The Deputy Chief Administrative Officer, who should have stepped in, also was in Kampala yesterday handling issues of PDM and traveled at night and was not yet very strong to join us this morning. Then my pass, Mr. Chikusa Mustafa, was also deployed, take another team to Rukunjiri this morning. And being next in command, I had to step in to come and be with you in this engagement. I am Behanikre Samson. I'm a Principal Human Resource Officer in the Office of the Chief Administrative Officer. I want to welcome and thank Mbarara University specifically. Those of you who are having engagements with them for the first time, we have been with Mbarara University in the health sector for some good time, supporting especially Bugoye Health Center 3. Want to thank you for facelifting Bugoye Health Center after one of the blocks caught fire, but you've stepped in, and for continuously supporting us as Kasese district, especially in the health sector. Now you're coming in with another program by way of responding to issues that are hitting Kasese and specifically the health subsector. Want to thank you that even when we are not there, you're thinking for us. You supplement our efforts, and we can't take that for granted. Want to send our gratitude to the university administration for always having Kasese at heart. You know, the post-extreme weather events have hit us. This is not something that we are about to be educated about. You know how Kirembe Mines Hospital disappeared post-weather events. You know what's happened in some of the facilities. Those from Karusandara, you know, and many others. The university comes in with this program of handling and informing us and getting the data about this. What do we need from you as administrators? We seek for your positive engagement and openness in giving information so that when they are designing their proposals, as they have said, we should be able to exactly address that which is affecting us, especially in the health sector, as a result of these post-weather events. I won't speak much, but to call upon you to participate fully. Feel free. You have our support. Bara University, we can pledge, like we have always done, that we shall always move with you in addressing the issues that affect our communities. I want to thank you and wish you the best of the engagement for all the time that we shall be here. I want to welcome you, and I think it's the next chairman LC5 here, and of his representatives. I think not. Perhaps they will be joining us at a later time. I want to welcome the RDC and request that he makes his remarks, then we can be able to go into full engagement of this meeting. I want to thank you and wish you the best. Thank you.
Thank you, Wanakau. That protocol observed. For people who just came in later, for the purposes, Richard Nsengiyumva is my name. I'm an assistant RD. I'm here in for my senior, Joy Walusimbi, the RD Kasese. He's engaged. We have the minister in Kasese over land issues. So that's why I'm here, and I want to say that I have sent warm greetings to you. For now, allow me to say that security as of now is calm. However, we have those land issues, but we are managing them. For today, allow me to say that I want also to supplement my colleague, thank the university, the Mbagala University of Science and Technology, for this workshop. One of the persons that are taking this direction, because by God's grace, this very year, I'll be also handling my bachelor's in civil engineering. So when I see my colleagues here, I feel so proud. So you're most welcome to Kasese, and I want to pledge to you that as long as you're here, feel at home. I'm also very humbled to hear that when they were giving us a preview, this program is not in Uganda, in the whole of Uganda. It is only here in Kasese district. So, omukonzo akabwati tubabandabandile mu byala. So my colleague is from Mbalala, may come from Muvende, but I've learned that one. So I believe that after this study, you have learned some Lukonzo here, so that you can effectively communicate. So it is, my colleague has mentioned it earlier, that Kasese we have been hit by those extreme events, weather events in particular the floods. The floods have hit us as much as possible. So, members who are here, I want to encourage you that when time comes, I heard that they are going to group you. Please give what is relevant, because it will help us to make sure that we come up with a guided research. In the case of implementation, we implement according to the guided research under science and technology. I believe that since all natives of here, we are likely to give what is relevant such that it can help us in proper planning and implementation. I therefore want to take this open language such that it is captured very well. I therefore want to take this opportunity to open this workshop officially and wish you a nice deliberation. Thank you very much.
Thank you very much, Bwana RDC, for opening our session. Members, now that our session has been opened by the Resident District Commissioner, without much ado, time is not our best ally. I wish now the DHO to come and make his presentation. Sir, you are most welcome.
Yeah, thank you so much, moderator. People observe. My presentation is an icebreaker of what is going to happen. The key presentations will be presented by, where we are here by other. As with extreme weather events, we look at what are places in Kasese, so that we are able now to work together as a team with different stakeholders to ensure that we solve the problem that caused by this. So present Luagonza Stephen on the district team, Kasese. So the current structure, these people are able to help us when we are looking at health systems, which people are available and are they able to execute the work. We begin with the district health office. When we look at the positions required from our principal human resource officer and COW, we look at our posts being filled to above 100%. So we should not fail to deliver the work required, that because we are not staffed at the district. So the district, as you look at the required posts by structure, the current structure, 100% filled, and we even have excess as per the structure, having like 2 drivers when the requirement is 1, having 2 officer tenants when the requirement is. So when you go down, the next is staffing. This is the number at the district health office, the general hospitals, approved posts. As of the current structure, we are required to have 343, but we currently have 165, leaving a very big gap which we need to be able to calculate in a short time. The health center force, approved posts are 130. The field at the health center 4, that is Nyamira, government will have 46, with a gap of 87, a very big gap. The health center 3 is 1,320. We have 20, giving a gap of 945 at 32%. When you look at our health systems in delivery in regard to human resource, we are actually performing badly down to handle the problems that happen on ground. So you look at our 87 facilities where we need 2,343, but standing at 838, with a gap beyond what is available. So we are actually not performing well, that we are able to deliver all the required services. As the hierarchy of systems functions, of course, we are headed by the district council. And the district council reports to the council. And then when you look at the executive, where our chief administrator, and as in health, the district health office, we now report to our chief administrative officer. But down there, on the ground, if I would begin it well, is the village health teams. This is where we have our community coming up to our health sub-districts, where we have the health center 4s, the health center 3s and 2s, and then we come down now to the district health office. The district health office where we report to our chief administrative office, who takes our issue. In regard to all the systems, all the work we shall be doing, this is the system we follow. And even this project we are going to handle will still follow the same system. Functions and players at different levels. The district council, what are they supposed to do? And what do they do? They are legislators who have the power to enact laws and ordinances. So if they look at what we are going to do in this project and feel it prudent, they can take it over and see what legislation, what laws are required, what ordinances are required, copying from the implementation of the activities. Planning and budgeting, as we are here, they should be able to look at all what we shall be planning, then service delivery, ensuring that services reach the population, then supervising the lower local governments and the revenue collection, like how they have collected this revenue, mobilizing what is going to happen. These are roles of the district council. Proceed. Then the executive, as per the hierarchy you saw, they initiate policies, they ensure implementation of the policy, of the activities and decisions made by the council, they give advisory law, they mobilize and encourage resources and encourage community participation, they coordinate and oversee all activities that we shall be doing, and I expected the executive to be here in this meeting so that they are able to own the project that we are going to do with this project. Costa. Now the district health office. As an office, we do health planning and action. We oversee strategic health planning, budgeting and coordination of all health, then ensure service delivery, monitor and evaluate all the performance of all activities in the district. Then we regulate compliance. We enforce professional ethics and code of conduct of our workers and ensure that all what work we do is part of the health systems. We also mobilize resources and ensure public awareness. As we saw by hierarchy, we also go down to the health sub-districts. And what do they do? This is where we have the health center 4s. By policy, the health sub-districts are meant to be at health center 4. Though in Kasese, have them at the general hospitals, like in one Uvera, but it's meant to be at health center 4. Time to members who are here, as we plan, we should think of, like now having Nyavirong, when it becomes the health center 4, having the health district at Nyavirong. Nyamirame as Nyamirame Health Center 4. Reshape, if we have, if you bring up Hugoi, it will be the health center 4, or him, or whatever will come. Not at. So the health center 4 also have a role. They also oversee the service delivery within the sub-district, and they mobilize resources, they monitor and evaluate, they do community engagements, and they also do the referral systems. When we look at our general hospital now, in Kasese we only have one, which is Bwera. We are doing curative services, we are doing emergency care. In the general hospital, OPD, outpatient cases, for your own information, ladies and gentlemen, the cases for OPD are meant to be less at the general hospital. We are supposed to be having more emergencies and more inpatients than the OPD. OPD is supposed to be handled by these other hospitals, the centers neighboring the general hospital. But you find us having much. So our major role is emergency care, surgical services, maternal and child health, the referral services, then health education and prevention, then hospital management. Our lower level health facilities, we do preventive care. This is where we have our community programs. We do curative services, ensuring that we treat all clients, those affected by disasters, those affected by all types of clients we handle. So this is where we have a strong team that is in actual implementation of the work. Then community health outreaches. Then we also do referral services and basic laboratory services measured at health center 3s. As per the hierarchy I explained, we have the village health teams down. Our members only will agree to this, our environmental officer. When the disasters happened, like in Chitolu, the first people were to report by call through our systems in health. We have a system called M-Track. We have VHTs. That something has happened. By that time in Chitolu, there were mudslides. But when the floods of Kirembe occurred, still the VHTs were the first people to inform us. So these are strong teams on ground that do community mobilization. They do home-based care, including psychosocial counseling. They do health education, referral services, distribution of health commodities. So like in these recent floods, even this disaster we are seeing around, I call it a disaster. We are already on ground ensuring that people have commodities like water purifiers. We are referring our people to the health center at Kasese Municipal Council. So we don't deal in one site, but our community programs is a structure that makes us effectively. The Part B members is going to be presented by my biostatistician. I was just giving a snap in Kasese and how do we operate, as I called it, an icebreaker of what is going to happen for our presentation. But all in all, when these disasters happen, and mainly floods, we follow the structure and the hierarchy shown above to ensure that we are part and working along partners. At that hierarchy, what I didn't bring out clearly was at each level, we have management committees and we have partners that we work with at each level who help us to do the work. At this juncture, allow me to end here and invite our biostatistician to continue with the presentation. Thank you so much.
Thank you, the DHO. Good morning to you all. Yes, my name is Tembo Constantine. I am the district biostatistician for Kasese. I'm here to share with you, in addition to the background that the DHO has already set to us, we offer or we oversee healthcare service delivery within the district. And as part of the game, I'll be showing you some of the outputs from the facilities as by the reports that are sent to Ministry of Health from Kasese district. So this presentation, we are going to look at the demographic profile and the disease burden. Then we shall also look at maternal child health indicator performance amidst the challenges that we face as a district. And maybe just to point it out, I did a review of the last 3 quarters for this financial year to give us a snapshot of what is happening in the district and how we are able to deal with it. Thank you so much. The first entry point is he has already given it to us. We offer care in hospitals, health center 3s, health center 4s, but also have the community. But what we target is the population of Kasese. So in here, according to the projections that were being, much as the census report is out, this current financial year, we are still working with our projected population, which is standing at 860,300 people. Among these, 49% are males and 51% of this population are females. So that is how we are working ourselves to understand who we are going to support, and then we plan how to support them, knowing our population. We offer care in different categories of people. So we target from the day a child is born onwards. We have different categories that we target for different services. So we expect 4.9% of the pregnant mothers who are pregnant currently to give us a live birth. Okay? Of the total population, we expect a live birth of 4.9%. When you try to calculate and subject it to the population, you will get to know how many live births we are expected to have in a year. This breaks our minds. There are some services that we immediately need to offer to children who have just been born, like we give them a vaccine called BCG. Okay? So knowing your population, even our facilities, they know their catchment area populations, and they subject these standard proportions. These are not district generated. They are standard population proportions by Uganda Bureau of Statistics. We don't generate them. We target the surviving infants. Out of those who are born, not all of them will survive, okay, by 1 year. So we target them for other services, and we take a proportion of 4.3% of the population to be surviving infants. There are other services that we extend to that category of the population. So it helps us to bring our focus to what services we need to offer them, what communities do we need to go with as we supply our services. We target them for vitamin A, 6 to 11 months. And you have also heard we run campaigns, like when we have polio campaigns. We are guided by those proportions. How many vaccines should we bring in the district? What should we request the Ministry of Health to give us so that we are able to run these campaigns and offer services to our population? We break it down to women of childbearing age. There are services that we target them for. So we have that in our mind to guidance. If you are going to target them like for tetanus vaccination, so that proportion will guide us. We target girls 10 years old for HPV vaccination. We have a percentage of the population that we expect, so that when we are going to the field, we know how many people we expect to find there. Pregnant women, non-pregnant women, the adolescents and the youth, the orphans and children below 18 years. So this is what opens our minds to what we need to have in place for us to extend services to the community that we serve. As earlier presented by my DHO, that we offer services at different levels. So we also offer services at community level with support of the village health teams, which I know majority of us know, the ones we call VHTs. They support us to provide integrated community case management. They offer services at community level. They treat malaria, they treat diarrhea and pneumonia for under 5 years.
but they also support us to give short-term methods for family planning. So they support us in that area. Able to report at the end of the month and the quarter to give us how many numbers they have been able to see in the community so that we know the picture of what is happening in the facility. The goal is to reduce the pressure at the health facilities. That's why they are supposed to see these children when they are still in the community. So if we see more numbers of under 5s at facilities than in the community, then it means that our community healthcare system is not working very well. But our agenda is to reduce the pressure at facilities, especially for the under 5s, because their conditions, the common conditions, can be managed within the community. When we cross to the health facilities, we measure, we expect, I know if I even ask in this house, how many of us have been able to visit a facility since the start of the year? Majority of us have not what? Have not visited the facility. True or false? Silence means consent. So whether sick or not sick, you are supposed to go to a health facility. There are other conditions that can be identified at early stages. When you don't, you yourself, you may not be feeling sick or having any signs and symptoms, but internally there is something that is developing. So we expect everyone to visit a facility. And 20% of the population should again visit at least twice, more than once. So we get how many people came to our facilities. And then we look at our population. So when you look at those figures, 0.8, that means I got how many came out of the population, and the proportion was 0.8, meaning not 100% came to the facilities where we offer services from. We don't know if they cross to the other district, but we expect that at least you access services, at least within your district. Even if you are at the boundary, there is a very big stretch for somebody to cross to Bunyangabo, to Lubirizi. We expect you to be getting services from within Kasese. You can see that across the month, the quarters that we are looking at, it's only in October, December, where our proportion went to 0.97. That is an equivalent of 97% of the population was able to visit a facility. Okay. So on the other side, it is more once for males to go to the facility. Males rarely go to the facility. I was in a meeting, and one man shared that they only go to facilities to have a decent death. They don't want to be classified as died from home. So when a man is about to die, that's when they run to the facility so that they can die decently. So health-seeking behavior among males is still very, very poor. Next. So among, when you look at the disease burden, we try and look at our data that comes from the facilities, and we look at what are those conditions that are being presented at the facilities. Okay? So topmost, we divided them into two sections. We have the under 5s and we have the above 5 years. Okay? But by looking at both sides, you'll see a condition that is becoming more common. You will see that cough or cold, no pneumonia, is the leading cause of morbidity among the under 5 years children. Okay, followed by diarrhea, malaria, pneumonia, skin diseases, intestinal worms, bacterial conjunctivitis, gastrointestinal disorders, allergic conjunctivitis, urinary tract infections, and then you can see that only 21% of the all other conditions is attending to the facilities by the under 5s. Now, when you cross to those who are above 5 years, now the ones, sometimes we call them adults, even though it's a mix. So above 5 years, we still have cough or cold, we have malaria, we have urinary tract infections, gastrointestinal disorders, hypertension, skin diseases, diarrhea, intestinal worms, tonsillitis. You can look at the list. When you compare the two sides, you are going to see some conditions which are common among males and also among females. And we target them. There are some preventive or control measures that we keep passing to the community health teams. The VHTs, they support us in educating the communities against these conditions because we already know them and we know some of the preventive measures that we can deploy within our communities to support us overcome them. Next. So allow me to cross to maternal and child health services and to look at a few indicators within that package. One is that life starts in antenatal care. When a woman gets pregnant, we expect this pregnant mother to come to the facility, not once, but continuously come. The target is at least 8 contacts. Okay? If I ask the mothers in here who has ever been at the facility 8 times during pregnancy, even when they are health workers, they are also still failing. Now, when you look at our ANC1, when I say ANC, I'm meaning antenatal care for the pregnant mothers. Whoever has gotten pregnant, please go to the facility. So we have those other proportions which I presented at the beginning, that we expect 5% of the population to get pregnant in a year. So when we receive these mothers at the facilities, we also subject them to the other proportion as all of it come to the facility. So that's how we come up with these proportions. Okay? So you will see that it's only the most recent quarter where we got almost everyone, 94%. That's why it has a green. When you see a green, know that we are doing very well. When you see a yellow, we are there trying. But when you see a red, just know that it is not okay within the healthcare. So that's how we so you see that most of the indicators, they are yellow, red. We have few greens in antenatal care. So we need a lot that we need to. So the cascade, you see antenatal care, NC1 coverage, NC first trimester coverage. We expect a mother within 12 weeks of getting pregnant to come to the health facility and start antenatal care. That is when that mother will make it up to the 8 contacts that we are talking about. But majority of our mothers, they come for antenatal when they are about to deliver. They only have to visit and tomorrow the baby is out. When you look at those who have made it 4 visits to the facility, that is ANC 4th visit coverage, you can see we are in yellow. Uptake of IPT3, we don't want to get malaria when they are pregnant. So we give them Farcida. That is what we call the IPT3. But we give them in doses. So those who have been able to take up to those 3, you can see we are in red, then at some point we enter yellow. We give mosquito nets during pregnancy. Mothers who come to NATO at first visit, we give them mosquito nets. But you can also look at the coverages also wanting. So, and all those other services. Next. So in terms of maternity, we expect the mothers to deliver. Okay? So how many have been able to come and deliver from the health facilities? So out of our expected deliveries, you can see 69, 64, 68, 69. We still have mothers who are delivering from homes. When we want to look at that, we compare those who received the BCG and then we compare with those who were born in the facility. So when you see even the health workers who are here, when you see your BCG coverage is up, but your live births are low, just know that they are community deliveries, mothers delivering in the community, but they have it in mind that they are supposed to come to the facility and acquire these services. So after they have delivered from the community, they come to the facility and get these services. So we have our children or births where the baby dies before the delivery. And we have those who die after they have been born. All those, we track them. When you see the FSB, that is fresh still birth rate. When you see MSB, that is macerated. child who was macerated within the womb. Okay? But our stillbirth rate is low. We thank our health workers and community health workers who have been able to support us, educate these mothers, that we have maintained it a little bit low. The mortality is increasing. If you look at the trend, slowly increasing, but we are having interventions to fight it. Okay? Next. So how do we fight mortality? Every mother who dies, every perinatal death that occurs in the facility, they have to alert our system that a mother has died. And as part of the game, we do what we call death audit to find out what caused the death, so that we save more lives. So that's the picture of we know where deaths are occurring from, and we are supporting these facilities to do audits at their facility, find out the causes, and then we come up with recommendations to overcome these deaths. Okay, so in the process, we notify within 24 hours. We should have alerted our system that a mother has died or a child has died. And within 7 days, we expect you to have made an audit of that death and given the Ministry of Health a report on what caused that death. So you can see that our facilities are able, even when they don't report, we still receive an audit report from them. Sometimes they delay to report, but within the recommended time, we see a report coming in to show that somebody died, and we have been able to do the needful as per the guidance from Ministry of Health. Next. So we identify some of the causes or complications, obstetric complications, which are reported in these facilities. And for the period that we have tried to review, that's the last 3 quarters, we are seeing mothers come in and they have eclampsia, sepsis, PPH, and the APH as some of the complications that they present with at the facilities. As part of the game, the perinatal deaths, the macerated, fresh stillbirth, those who have been born and within 7 days they die, they also alert our system, and we are able to capture them, audit, and find out what is causing that mortality. Here, as our facilities, we are still not doing very well in terms of that component for auditing the under 5 mortality to understand what is causing these perinatal deaths, and then we come up with solutions to improve the situation. On the next slide. Okay, so it's like a fresh stillbirth. To those who are not medics, is you have a child and the child dies when he's nothing, like the whole body is okay. Huh? A macerated stillbirth is a child, I don't know who can open a macerated, I know it only in one language, but you cannot even identify the child. Child is already messed up within the womb. So a fresh stillbirth indicates that during the process in the maternity, the process did not go well in terms of handling the delivery. Other factors could be there, but the main that we want to understand, what happened? Did you do the rightful job in maternity, in the labor suite? When we go to the macerated stillbirth, if you are reporting a lot of macerated stillbirth from your community, that means there is a problem at community level. That's not an outcome of maternity, because the child comes when he's already messed up. So we need to understand more about the life of the pregnant mother than what was done by the health workers within the facility. Okay, so this one I had already hinted on it, how we are auditing. And the good thing is that for those perinatal dates, we have also tried to analyze and look at, are these mothers also attending antenatal care when they are pregnant? So the audit report always reveals to us, you can see that out of the perinatal dates that we have had in the previous 3 quarters, 78% of those mothers had attended to antenatal care so that they can have a safe outcome at delivery. Okay? So that is a good picture. So lastly is the child health, where we look at immunization services. Now, we offer a number of antigens. There are many, but I try to pull out a few. There are new antigens that they have introduced, like the malaria vaccine, which we have just started reporting on. So it may not be here for now, but you can look at our coverage. Overall, where you see a red, just know that that is a new dose that has been introduced. But as Kasese, we have tried to at least maintain category 2. When I say category 2, that is, there is good access to immunization services, but the utilization might be what? Might be poor. People are able to start, but continuously taking on the immunization services to the recommended doses. So there are so many challenges that affect our communities, and I think that's the reason we are here, to share those challenges, and then we can help our healthcare system to improve and offer services well. Kasese is among the districts that are fighting the measles outbreak. You can see the number of cases. We have 50 districts that are struggling with measles, and Kasese, at least we have reported above 3 cases of measles, positive ones. So we are in a silent outbreak that we are fighting. We are trying to respond as a district. We have challenges as already highlighted by, I remember Kao highlighted some of the challenges. Infrastructure is one of our challenges that we have in the district. And the other challenges I know will be presented. But due to the situation that we are in, whenever we are hit, we suffer other unexpected challenges. We find there is increase in teenage pregnancy rate, which I may not have given you the picture of how it is standing. But as a district, we are struggling with teenage pregnancy rate at 21%. Increase in incidence of waterborne diseases. Whenever we are hit, we see an increase in the incidence of diarrhea cases and so forth. So we keep fighting in there, and with your support, we are able to respond to these. I thank you so much for listening to me, and I beg to end it here. Thank you.
Yeah, this has been a snapshot of the health office, and we have not gone in details of the interrelation between now the extreme weather events in relation to health, which we thought is going to be a discussion that should be why you came here, members. We have the issues, like the issues looking at how the floods have caused infrastructure destruction, how water sources have broken down, resulting into waterborne diseases, increase in malaria cases, how TB cases are increasing due to overcrowding in camps, how we are having the effect of the teenage pregnancies in overcrowded places like in the camp in Mhocha, the issues of sanitary facilities breaking down, the issues of the facilities being destroyed, like Karusandara Kilembe Hospital, where mothers failed now to come for these services. You find like a mother being brought when the Kilembe Hospital was broken down, how mothers were struggling, pregnant mothers coming to St. Mary's here. A very big challenge, contributing to the that you have seen, contributing to the perinatal deaths. All those issues, members, you know them and you have them at hand. We thought to be a discussion generated by members invited, so that you own what you have discussed. What is the relationship between these events and health? How much between these events and health? How much has these extreme weather events like the floods affected health issues? These extreme weather events like the floods affected health issues. Make a nice break of opening up the discussion. Make a nice break of opening up the discussion. so that we shall lead the discussion and then you'll be able to think to yourselves, so that we shall lead the discussion and then you'll be able to think to yourselves how you feel the change in the weather, like in the drought, like the feel the change in the weather, like in the drought, like the floods have affected you in your households in terms of health. Much of the details of the extreme weather events is going to be presented by our environment officer who's supposed to come on ground. I hope he's ready. Let me hand over the microphone to our MC. Thank you for listening to us.
Thank you very much, DHO. Let's give him another round of applause, please. Well done. DHO, let's give him another round of applause, please. Well done. Okay, so I think on a DHO, I don't want to play most of the people, but really your views have been well made, and he has been able to interlink health towards the adverse effects. And one of the examples of myself, DHO, on your behalf, I also like telling people that adverse effects also affect malnutrition. I don't know if you know about that. So when you see children with the malnutrition, due to extreme weather. So I don't want to preempt Ndando Yomushakulu, but there will be someone to come and walk us through what is going to happen in the next discussion. So I humbly ask the participants, we are going to have a group photo with the Red District Commissioner. We shall straight away go for our break tea, and then as we come back. Thank you very much. So that my senior brother colleague can take us to the next session. And without much ado, let me welcome Mr. Foley, senior environmentalist, to walk us through his presentation that is premised on historical and contemporary context of extreme weather events in Uganda, but focusing on the Kasese area. Foley. Colin, without much ado, please, you're most welcome to walk us through your presentation. Karibu.
Yeah, once again, my name is Cody Augustine. I'm the Senior Environment Officer, and we'll present on especially disasters basing on what we've perceived as occurrences today, but compared to what used to happen earlier on, because most of you people were not yet born, and therefore this is the time for you to respect the elders. Whatever an elder tells you, just know that it once happened. Only that your generation that starts with you is what's trying to make things difficult. You may think that maybe my father never put in place measures to avoid disasters, but this is your time to ensure you begin. Now, you may check like this lady here, the way she's seated in an extreme, awkward posture, very extreme. This lady here, she has gone beyond the recommended sitting posture, such that even other private matters are being seen. That's going extreme in your sitting position. I'm not saying you are sitting badly, but it has gone extreme. When something goes beyond, we say it has gone extreme. So in this context, we are going to see what kind of extreme weather events, how they look like. How would we consider a weather event to be extreme? We therefore look at the frequency and severity, how often it has been happening compared to the normal, and how severe it has been, basing on maybe the number of deaths, the number of the level of destruction, the level of injury, the level of displacement. That's how we term the extremity of weather condition. That is our Kasese. Its position in Uganda. Remember, it has never been split. We are still intact. That's where we are. But what's the most important is that our Kasese is too small. It may look very big, but when you look at the actual land that's supposed to be occupied, that's supposed to be used, is too small compared to the population. So you may begin to think right now that what are the implications of this small piece of land? Even right now, as I speak now, people are fighting for land. They may be physically fighting for land when also you yourself at home is fighting for your piece of land, because it's no longer giving you like it was supposed to have been giving you. What happened is therefore to leave that land and go and do your activities in a more, maybe in a better area, which better area that you think may be a riverbank or maybe a wetland. That's the implication of map of Uganda, of Kasese. The land area, like we have said, area, but what is important is that what is that less than half of it is available for use. And that's the population. It's very important. Number 3 is the topographical features. The topographical features will guide us in trying to show the causes or the drivers that maybe could be responsible for the current occurrences of our disasters. We have the mountainous areas, about 1,600 meters above sea level, beginning maybe in Kilembe, moving upward. Then we have the undulating region, that is 1,200 to 1,600 meters above sea level. Areas of Charumba, Chondo, Mahango, but this topography also is a serious driving factor. Remember, last year we had the landslides that were being exacerbated by the slope and then maybe other soil characteristics. But the slope is very important in this. Now, when we have the lowland, the flatland areas, that's the lake region, that is a bit flat, we still have other clusters like the continued or the prolonged dry spells because of the extent of its flatness. This one also will keep running in our minds in trying to compare to the reasons why we are having continuous disasters. Now, these are the common weather stroke climate which you already know. The floods, landslides, stroke mudslides, long dry spells, hail, windstorms, ceramic, crop raiding, animal. All these are climate related. Who can explain to us the extent to which flood is climate related? Why do we say a flood is a climate related hazard? That we go on understanding some of these things. How is it climate related? A flood. How is it weather related? And where? Yes. Have you heard the word rain? Yeah.
Thank you so much, sir.
Yes.
My understanding of flooding in relation to climate is that when heavy rains occur, say in a given season, they lead to increase in water levels in the rivers, and the rivers end up bursting their banks and therefore causing flooding.
Therefore causing flooding. How many times, Dr. Waseke, since you were born, how many times has, since you were born, since you were born,
At least every year, either 2 or 1.
either twice or once, it has flooded in a year. Now, how many times has it been of concern your people in the area where you live? How many times since you were born?
And you see, there are things that are happening, but if we don't open the eyes of people, it's as if it's a normal happening. Most of the time, these things are happening, but we are not being informed why that is happening.
How many times has it been a concern to the people of the area where you live? It has been flooding since he was born, at least twice a year. At least twice a year. Now, how many times has it been of concern from Nindon? How many times has it been a concern to the people where that river flows? Now, what I'm trying to say is that even in River Nyamwamba, like this last season, did it flood? Did it flood? Yes. Why did people take concern that people kept quiet even when it flooded? It flooded silently, unknown, and whatever, and people remained where they were. But 2013 or 2020, why was it an issue of concern? Why was it an issue of concern in 2020?
It was disastrous in that there was loss of life and property.
Number one, loss of life. Number two, loss of property. Number three, destruction of property, destruction of crops. So in 2020, it was an weather event that resulted into flooding. It was extreme. It went extreme. That's why we are saying that but extra weather events. Get the point? Then storm. Why is it climate related? Hail or windstorm? Why is it climate related or weather related, things like that? By the way, these things are supposed to be part of your daily kind of thinking. You should always be thinking about them, you as a person, or you as a head of household. How is it a climate-related event? Amatwe. Yes? Akasobutukubembula now. Yes, akasobutukubembula now. So meaning, but amatwe analeta usharimbulu. It cannot happen. Akawenembula. So we receive hails, we receive rainfall. How the hails are formed, I'll take you through that one. Now, why does it become an extra weather event? Why?
Sorry. Now, let us begin thinking of which extra weather events we have experienced out of this hazard now. That's what we are looking at. Now, to see we go backwards, that previously what used to happen in terms of floods was Nyamwamba flooding every year, every season. What was the return period for the river Nyamwamba flooding? That's what we are looking at. A return period is the time it takes for a river to come back to its flooded situation. You are using a baseline of the previous flooding. Okay. Now, they are telling us that the contemporary, that's the recent and current weather event. The extreme weather have occurred recent or current, that is today. These are the contemporary weather events, extreme weather events. But if they are historical, we look at what time it occurred, history. And even climate also is part of history, because we take about 30 years. There is some bit of history and the present. That's why now we are summing them up as contemporary and historical. Because when they say what is climate, you look at the contemporary and historical from 30 years to date. Even the contemporary, extreme weather events, we look at the historical and what's happening right now. So, we need to note, where does it come from? The rain that we receive in Kasese. How is it formed? Where does it come from? Is it because we have an equator here? And therefore, the place of the equator should create rain. Is it because we have Rwenzori Mountains National Park and then we should have rain here? So why do we receive it every day? January, February, March, April, May. Why should we say the planting season is elapsing? Why should we say we are waiting for the rainy season? We are waiting for the rainy season because the climate is influenced globally. Get it? Global climate influences continental climate, and continental climate influences national climate, and therefore the local climate. That based on the various factors you hear of sea surface temperatures, that's very far in the Pacific Ocean, which causes the high pressure, the low pressure, and therefore that wind comes towards Africa through the Indian Ocean. I will not go into detail. And that wind is also influenced by what we meant here, the position of the overhead sun. As the earth rotates, it rotates around the sun, also it's around itself, revolves, things like that. We shall receive heavy moisture-laden wind or air or moisture. But some of these factors here, the Indian Ocean dipole, the position of the overhead sun, that's the ITCZ, where is it? The Congo air mass, the influence of the circulation patterns, that's topographical features, large inland water bodies, tropical cyclones, especially here. That's where now we say, Kasese, we are receiving rainfall. Because rain that will come from Pacific Ocean, if I can mention that air will be moisture. Like dropping this moisture, maybe to reach the Ethiopian highlands, the southeast, and the monsoon trade winds. They will come drop the moisture in the Ethiopian highlands. It comes the tropical convergence zone, the air converges, but Chorongo becomes the hottest part of the district. But because we have these features, the air will be condensed as it rises. because we have the inland water bodies, it will find some moisture already on our Lake George, Lake Edward, Kazinga Channel, after the Lake Victoria things. And then that air, we need to drop some moisture in Kasese, but it will not, Kasese municipality. Why? Why will it fail to drop moisture in Kasese municipality, but drop it in Kilembe, or central business? That's what I mean. Hapo kia wa Kilembe kia ndio mwana ni mwatani mwana. Four patterns, that's what you're meaning. Hapo chimbulia wa Kilembe kia ndio mwatani mwana. The reward, flat area, nothing to raise the moisture. So area, after dropping rain in Bunyaruguru, it will come over Lake Edward, continues to Kilembe, and it will become by the surface moisture of the lake. It will also become enhanced by the transpiration processes of Rwenzori Mountains National Park. And here, there is heavy rainfall in the park. So after that heavy rain in the park, what happens? It will bring us back the water in the form of flood. And eventually, the people of Kanyangea will drown when the people of the central business district are burning of it. Some of those things. Now, because of this, you will now hear that we received no more rain. Based on what happened in the Indian Ocean or whatever, you will hear of near normal and you will hear of above normal. If you always keen interest in the forecast information from UNMA, now Minister of Water and Environment, that's what happens, because they already know how the wind is being formed in the Indian Ocean, the Pacific Ocean, things like that, and how other things will affect now the weather patterns. Now, historically, like I said, that our national and local climate is determined globally. What's been happening in Uganda has also been Kasese, and basically affected by the location, the geography, the drainage, the climate change, the variability, soil type profile, and things like that. You will hear that floods have been occurring in the entire Uganda. Both flash and the riverine floods have been happening in Butaleja, in Soroti, in the Teso region, the Bududa, things like that. All those have been happening. But the issue is the frequency has changed. The frequency have not been able to predict, or we have been able to predict previously, but today we have been able to predict. Yeah. So they were happening from what is the word fragile? What does it mean? Engineer, the word fragile, handle with care. It's fragile. Delicate, like a glass. When you go to a river bank, because there is high population pressure, and therefore you want to cultivate to have crops. When you go to a wetland, you want to cultivate because you want crops. You are moving to a fragile ecosystem that you may destroy it within 1 year. Yes, we give it. But putting it back will take you 10 years. For it to be able to give you the same service that it used to give you, it will take 10 years. So continuous destruction for 2 years may mean that we shall take more 20 years to take it back. That's population pressure. And therefore, our capacity, the capacity of the earth to intercept or to provide those services are no longer there. Second person, why do you think flooding has come to extreme, it has been termed as an extreme weather event now compared to 30 years ago.
Another
Why?
reason is
Yes.
could be like tampering with the water channels, of course, as a result of the population increase and the different activities carried on by the population.
Flooding is a natural phenomenon in the river's hydrological system. River's hydrological system. Say tampering with what? The water channel. How? How? Be specific.
The population has gone on like, of course, trying to carry on some different activities, including industrialization, agriculture, and the construction of houses. And this one has led to the tempering of those water channels in a way of looking at development rather than reserving the natural sources like the rivers. Thank you.
Yeah, like I said, flooding is a natural phenomenon. Where when it occurs, there is erosion. Where will the flood waters erode? It will erode those weak points where you have cultivated. And eventually you say the flood is hitting us. That's why it's termed an extreme weather event. Because you have destroyed, you have weakened the capacity of the river banks to hold the water and let it flow and by that. Get the point? Yes, Papa. Number 3.
I wanted to build on that.
Yes.
You look at, we talk about the floods, we definitely move at our settlement pattern. The way people settle today. There are valleys that were prohibited from being settled into. But today you find people are building in real valleys where the rivers used to pass before. And when the river wants to come back to follow its original route, then you say floods. But initially, those rivers were passing there even 30 years before. Look at Kasese municipality. This was a valley for River Nyamwamba. But now it is fully utilized by human settlement. And when the river wants to visit its own origin, people say it has flooded the town. Thank you.
Yeah. We said a river is a natural phenomenon. That's what we said. But we now call it an extreme weather event. Something natural. Why do you call it an extreme weather event? Because it has destroyed life, it has destroyed property. When you take your property to an area where a river used to flow, what do you expect? Then you will begin lamenting that the flood has become extreme because it disturbed it in a way. That's what you're looking at. Any other person? Yeah, so previously we said that we have the March FA and would plan for it. We had the sun, September, October, November, December rainfall, and would plan for it. But today we plan, it's not as we expected. They say we are talking of major floods, current flooding occurred, people affected, climate mines, whatever. All these things we've discussed. We'll not go back to it. These are the weather events in particular that we are talking about. Okay. Now, of the issues that we take into account as calling it an extreme, because it's destroying department by department. Outbreak of disease, destruction of water resources, like you can see. You go to production, agricultural infrastructure and assets, also food shortage, increased incidences of pests and diseases of food. All these qualify flooding as being now in extreme. Yeah, this is a summary of what we have so far fed is also hailstorms, at least takes the highest toll. If you can see this one, 1st May 2013 up to 2022, 2023, why can't you qualify as now being experienced as an extreme weather event? For sure, why? You've lost your loved ones, your groups have been destroyed, your social infrastructure have been destroyed, our roads are no longer passable, the bridges have been taken away. Why can't you qualify as the rainfall pattern? Catchment degradation in the catchment. You know what the bog? Who knows a bog? Mountain bog. And what it does in reducing the risk of flooding. Jose, at least we are two here who have been able to reach the snow. The risk of flooding.
When we talk of a mountain bog, we definitely mean something worth a mud. To the language of the mountain, we say it is a bog. Upper big bog, lower big bog, ebyondo, ebyeyiwuru, ebyondo byeyivu. Now, what does it mean? When you reach there, you'll find that all the water tables are reserved and preserved by those water. We call them bogs. But pass there. If you don't pass on those walkboards, you can easily
drown. The whole of you drown.
You down there, and you can be helped by experts like me who have hiked there 30 times and beyond.
Okay, sit down. Sit down. Now, this vegetation you are seeing is this, which you call the tussock. The tussock. When you talk of catchment degradation, is that this vegetation here is becoming destroyed. And when it becomes destroyed, it means this 2-meter tussock, the work it used to do 2 meters like this, all this is a sponge that intercepts water here. So when it gets destroyed, then these bogs also become destroyed, and we get this type of valley, U-shaped valley up there. Meaning that whichever rainfall we shall receive will just be flowing without getting intercepted. So when we go back to the historical weather event, that Nyamwamba used to flood for 6 days in its flooded situation. But today, it floods for 6 hours. Previously, 7 days. Today, 6 hours. And it has destroyed everything. That's the reason. Ecosystem degradation in the catchment. Yeah, these are the ones, the poor land use, the Nyamwamba division, whatever, central division, loss of riparian vegetation, the vegetation that lines along a river valley, river bank. If we lose that root system, it means therefore that the soils will be so much loose and susceptible to erosion and possible breakage of the river bank, then migration. In some cases, that bridges restrict the active river channel, and therefore water fails to pass. So the causes, we can say, climate change, catchment degradation, then high rainfall, but these others become contributing factors. Others are causes, but the rest are contributing factors. If you look at the number, the second last bullet, a bridge. Yeah, a bridge. This is what I mean. A bridge. This is the channel width from here to here. Engineer, I hope you are listening to me. Yeah. This is the channel width from here to here. Then my good engineer comes and builds a bridge.
Yes, engineer.
Now say where, but even if you can't say poor na poor. Yeah, poor na poor. You plan your bridge based on the flow rate today, flow rate and flow velocity today, not knowing what would happen in 10 years to come.
Of course,
As a contribute,
Kuba na Marangira, actually the bridge is almost halfway. The bridge which is constructed is almost halfway the width of the channel. So, meaning that part which is left, actually that approach towards the bridge,
it's called approach.
Actually it is called approach. So that part left, actually it will be where actually the water will be now underscoring.
Yeah.
It's going to wash away that approach. The rear sea or where it is hanging. Yeah.
So to go to as we build these bridges, we should integrate environmental issues. We should integrate disaster issues in bridge construction, in road construction, even your house at home. We should integrate, because disaster risk reduction is successful at that household level. Now, this friend of mine in the municipality, he was told by this signpost, this pillar, that this is a water channel. Now, in between, you bring your house and put it in the water channel. Now, to reach, the pillar is here, is seeing it clearly. How Chiriango Haria, opposite Chiriango. So these are contributing factors, not causes. Yeah. So far, there are responses that were so far made. Government and development partners. I mean, when I say government, I now Kasese local government is dredging, settlement of platform communities, as Kilembe, early warning systems, implementation of early actions, whatever. But what's most important is this structure. The structure, just the management committees from the district, municipality, sub-county, and the village selected areas. Then the early warning systems, and the plannings, the decap, the whatever, all those contingency planning, all those that we have done. But still, now that we're having a new project, we can see what happens in addition to what we put in place. Yeah, that's the conclusion. That reduction requires combining structural measures, ecosystem restoration, community preparedness, and sound governance. That is the governance to be brought by this structure. The institutional structure will come from that. The governance will come from that institutional structure. They said, so better off for us. I thank you.
Okay, integrate disaster. Now here there is a physical planner, law enforcement, chairman LC1. The person comes to buy a plot next to me, actually above me, and he has no house plan, and he's becoming a risk, because the moment it has at me, the moment there is any kind of mudslide, his house will immediately come to also break my house. So, we have physical planners trained. Now, in this case, if this innocent person who has just also been able to buy this casino plot above me, because he has been able to find his little money, he also wants to find a place of abode, innocent. But the also chairperson accepts that this person, they even sign on the agreement. The physical planner who is supposed to be technical, and the law enforcement that we entrust that they know they understand the law, they accept that this person constructs. Now, in this case, if there is any disaster, who do I sue? Do I sue the person who has affected my own house? Even when I try to integrate, or do I sue the physical planner as an individual, or the chairman LC1 as an individual who accepted this person can be able to follow? I thank you.
Yes, Chairman, my Chairman LC3.
Thank you very much, Olive. Those who came in after introduction, I said I'm Bumera Richard. I'm a chairman LC3 for Bulembia Division. I also chair the committee responsible for the Nyamwamba catchment issues. I am also the spokesperson of the NRM of the municipality. And I also said there is a new project which is being implemented by Mountains of the Moon, and also Uganda Matters University, about the PSF community resilience in relation to disaster. And Oliver is a very good member of that committee. My concern is about the presentation by the health office. Here, my very good and long-time friend Bagonza said that they were aware of so many challenges, but they never wanted to bring them out. They just wanted them to come out of the participants. I asked myself the reason why he chose that, even after I had mentioned the Kilembe Mines Hospital. I always use the history to predict the future. I am always proud of myself. By some time back when I was still in school, in 1994, we had an organization called the Rwenzori Students Association. And our president, the late Pascal Move, mobilized us and we had a debate in Vienna, reflecting on history. And the discussion we had, we created the then chairman, LC5, Mzee Bamsede, and it resulted into the construction of the monument at Kagando for the remembrance of the three men who were publicly executed in 2021. Now, my brother Bagonza makes a presentation, and he doesn't bring out the resilience of health, where Kilembe Mines Hospital has come out and where it is today. Then I am wondering what type of information the Mbarara University people are going to take. My request would be, Madam Olive, that at least the Department of Health, it wouldn't have been a crime if they brought out something. I am always feeling touched. One time I attended the conference for Kasese Municipal Council, and where I saw under health, they had reflected other private health organizations and facilities, but deliberately never brought out anything about Kilembe Mines Hospital. Little did I know that that was the way of really completely fighting and destroying of Kilembe Mines Hospital. And I heard Bagonza mention it, that Kilembe Mines Hospital disappeared. He mentioned it himself. And therefore, when I arrived here, Madam Olive, I was told that Kilembe Mines Hospital had been invited and they were meant to also make a presentation. But on the I am not seeing it. Then I was suspicious that maybe Bagonza was part of the organizer. Good. And they had to not to allocate some little time. It is not my day, but at least I am told the presentations are in group work. But I hope this question is not answering the question directed to Bagonza. Thank you very much.
Thank you very much, my chairman. I am inviting two more questions so that we can end the discussion. I saw a hand somewhere.
There is a question that is not yet answered from somebody.
The answering will come after we have posed the four questions. So let us be patient. Microphone.
Yes,
My name is Charles Cashon and the conversation. For the time I've been here, we have engaged in disaster-related programs. But we find that our interventions are only tied to funding. Even when you ask the district, they will tell you funding is a problem. Here is an organization like FURA that has implemented from a donor perspective, and the communities are doing well. But then the donor says there is no money anymore. And we find ourselves in that dilemma. So my appeal and maybe a suggestion that how can we move and sustain the interventions that have been put in place in the previous emergency engagements to make sure we move forward. Thank you very much.
Thank you very much. One more question. Thank you.
Thank you so much. Luke Isaiah, team leader at Young Agro Green Africa Network, but also I represent KMC NGO Forum. My question is a reflection on the last slide, which Mr. Colley presented. Why is it that when we know that we are overburdening our planet, especially here in Kasese, the policymakers, the technical persons, we are failing to initiate, probably come up with an ordinance that prevents or protects the already existing ecosystem. But we continue to allow people to reclaim our small wetlands. We give them permission to construct, and we are not enforcing the laws. What about if we come up with an ordinance that prevents or protects any person who stays near either the riverbank or is practicing an agricultural practice in the riverbank, those who are using wetlands in a bad way to stop? What is failing us other than keeping lamenting on how we are destroying the environment, especially in Kasese?
Thank you very much. At this moment, I'll go on with only the... But I want us to remind ourselves and keep this information at the back of our brain that this workshop is on information gathering and building consensus. And this means that we will not talk about funding, mention it in our groups as we go for the discussions. Someone is having a burning question. Burning.
Thank you, moderator.
Kindly be.
Okay, but it's not a banning. I thought it should also come alongside other comments. First of all, I want to look at the component of what Paul said, the keyword of integrating. And maybe technically, my brother put it in a different way, but in the perspective of what we are doing today, I looked at it as having an integrated approach in different aspects of how health, social, economic kind of planning, we need to factor in the component of integrating all disasters, because disasters affect every aspect of life. That's one. Two, there's also I also captured one aspect of the data. Actually, he was the one. And my recommendation was also to put more emphasis on the primary data and also the secondary data which is in place, but more specifically for the donor interest, it would be very prudent to really rely more on the primary data because it tells you what is next. Then also You said I have to be brief. I just request for more 10 seconds. Then also the operation and maintenance. One participant has talked about sustainability, which is very key of whatever we do. And what we have seen by experience is also the scope, the extent to which services go, and also the box. If donors brought funds today, then what next? So my recommendation would be putting in place strategies, documented strategies that can inform the future planning and see how best we can have and touch base to the available opportunities. So I want to stop from there. There is a lot I know we are still talking. Thank you.
Thank you very much. I'm also going to answer the very last one. Put in place strategies. That is the reason we are here, so that it can inform future planning and implementation. Right, Dr. Cody?
Yeah. Mr. Chiwede and the NGO Forum representative, the question looks the Republic of Uganda is not sleeping. You've been saying it saw them, the government saw them earlier on. Why? They realized there was some kind of issues in the issue of land titles, especially land titles that were being issued in wetlands, riverbanks, and lake shores, especially in the Kasese municipality, Kampala city, and other urban centers. So what happened was coming up with a law 10, which is actually working. Every district municipality has a physical planning committee. Every town council has a physical planning committee. Chairman, yeah. So the work of the physical planning committee is to ensure that whichever title that will be offered is not in any kind of fragile ecosystem, things like that. And that's why on every physical planning committee, either a forester, an agricultural officer, or an environment officer has to be a member to guide some of these things. So that if a title is to be issued, ecosystem should not be given out. Its implementation is being faced by bribery. You people are bribing that committee. This one I saw in Kasese when we were trying to control issues of titles in that Salt Lake. What actually, why I gained much kind of vigor is one of the very big government shots in this government when he said, you people what are doing is right. For that matter, let us do A, B, C, and D. He understood. So whatever we do, please assist these physical planning committees. Now, in addition to that, after acquiring a title that maybe is not in a wetland or whatever, if you don't have a title, government has again come up with the Building and Control Act that has led to the formulation of the District Building and Control Committee. So that you have a title, you could have acquired it some time back, but now you want to build. We shall scrutinize all the documentation and whatever. It's also a process until we allow you to build. Those are some of the efforts or initiatives that the government is coming up with to ensure some of these things are reduced. And we live in harmony with nature. So whatever happens after that is now between you and the committee. And I'm very sure you cannot bribe a committee of 12 people. How much money do you have? And some of these bribes, you may bribe other sectors, but when you bribe in nature, in those fragile ecosystems, it has they go to what? Flashback. Natural disaster will take the day. Yeah. So go benefit. You will bribe somebody, but when they try to get to give you a title, that computer in EMSO, in Fort Portal, will say, but physical planner, as if this title is in a riverbank, because they have all the gadgets now to see whatever we forward to them. So we should be careful. Things are changing, and the government is very much serious with it. I think it also answers your question. Yeah. No more lamenting, but the law. If you allow the law to work, it will work. If you don't allow it to work, then backfires will always come up. Like if you don't calculate those building material and whatever, the BOQs, a 3-storied house will fall, and the backfire will go back to you.
Yes, my boss, you have not answered the query of, in case there is such anomaly, who should I sue? Please answer.
Has put it clear according to the
Is it okay? Okay. Thank you very much. Right away to the PH.
Have it. I would request just to respond to one of my posts here that not mentioned is the objective of this meeting, that we want to post what into the fund. We want you to come out clearly on your own and mention health-related challenges in the disasters we have seen and what is feel should come out and what is done in the name of Bible. We have a lot. We have written the concept, and the challenges are a lot. Submitted to Prime Minister where responses are minimal. But when our funder, Reshape, hears from you as a primary person in the discussion we are going to get, it will be answered. That is the response. I would request you end this.
Okay, thank you very much. You've understood his saying. You're the people who are faced with the extreme weather effects. Why do you want him again to tell you that if you do this, this is going to happen? And yet we'll have discussions ahead that will bring out those issues clearly. Thank you very much. I take this honor to invite Mr. Moses to come and take us through the stakeholder mapping process. Thank you. Yeah.
That session. My session is going to be very brief because I know I'm between you and lunch. So I'll try to be as brief as possible. What we are going to do, I have, can you reach there? Okay, try. So we are going to do a simple task. I have here different types of sticky notes. So let them first open all of them. Okay. I think these are highest. Let me get there. So I want to identify that are supposed to participate in ensuring that healthcare services continue operating in times of extreme weather events. So we are going to put down those stakeholders. We are going to use these sticky notes. One, I'm going to explain them because the words are small, but when you put your sticky note, you'll be able to read well. This is for internal stakeholders. So you identify any internal stakeholder that is responsible to ensure that health services continue even after extreme events have happened. Then the external, you do the same. Identify an external stakeholder who's supposed to see that services of healthcare continue amidst or even after extreme weather events. Then the last one here is
you put for us what the role of the stakeholder is. So if you talk about a stakeholder like MASK, you come here and write on your note, you put MASK and then show what it's supposed to do. So that's what I'm going to do. Let me begin with the yellow sticker. So for the yellow sticker, write any internal stakeholder that you know who should be involved and participate in ensuring healthcare services continue when extreme weather events happen. So that is the yellow. And maybe I'll request that help me just give, but if you don't have any stakeholder, you are free not to write anything. You keep you keep the sticky note. Yeah, that's a good one. Then on the pink, let me first explain the colors. Please, these colors are non-partisan. We're using them for gathering information. So nobody should bring in any term. For the pink sticker notes, write the internal stakeholder. Pin one there also. Yep. External. Then the last one is orange. You write on top of the orange paper sticky note the stakeholder you've identified, and then write below the role that is supposed to perform. Let's do that quickly, and then we can break for lunch.
Thank you very much, Mr. Moses. Thank you very much, Mr. Moses. What Mr. Moses is saying, someone who had a hand behind and you wanted to understand what internal stakeholder means, external stakeholder means. Now, what Mr. Moses is saying, that in the event that we are faced with extreme weather conditions, I mean disaster, who is the right person to intervene at that moment? Or even after the event has occurred, who is the right person who can come in either to offer a hand in terms of health service delivery? I've been tasked to explain it in Rukonzo. Yes. Echamukuru akareribuwa akabuwa ati omwamuro truka sirivawana mehitro eikasabusa nana erisenderwa maetse ne mundu wahayi ama ni ofisa wahayi ama ni political person wahayi ama na opinion leader wahayi oyo wangatroka erituwa ticha internally itwe omwa district mwahano amaetama averetroboeramu ninde eyo wangatroka yaridengekania esahano utanga kutibitira inyakuwa ticha no mwamuhuru twa amaetya yavire tusenderamu abiritandiya vendu abandu amasipatara virenda chitya wangata saprokeriko kwa sipatara ne mundu wahayi omwa Kasese district mwahano eya ukalengekanaya utyangana kuhereri obuwa ticha after erisenderwa mwachi amaetse singa twana machitereria ye internal halia internal. Okay, so external is obuwa ticho bwangarwa hihia ye district in case kama senderwa amaetse na after erisenderwa mwachi amaetse then ukibya wabiri identifying abantu abo wabiri bahandiko kwa kastika note akabiri kuhereria then ukekanganya uti omundu molebe tukwetu wamabwa uti healthy inspector of a particular area or sub-county neriwa kanganya uti omubiri wiwe atwala rinya courage omwamuru twamasenderwa mwachi amaetse. Those are the roles now. Twana machitereria Thomas Frataiteria Mamma Honjanga Mindus Matachi, Dr. Okanza de Chisavarera Kurava. Of stickers, the obosi. Of stickers, the obosi, Wamabu Yitaga, Itoku of stickers, Vongahi, Osatu. Wanganato Keri Hirako internal stakeholder, Wanganato Keri Hirako external stakeholder, then Wahirako Nesha roles. We've understood. Yes, we can. If you want 3 stickers, we shall avail them.
I know there is always a problem of color blindness, but when you reach here, we shall call somebody to help you identify what you have written down. But for now, when you are done, just exercising, walk here gently and place your sticky note at the right flip chart. And don't worry about saying you need more paper because you have many stakeholders. It's okay. Those which will fit on the small paper, you can stop there. If we miss them, you again elaborate them later.
We've started noting down. You begin with internal, external. If for you're for internal, you do internal. Those for external, you do external. All. Okay.
In the form of stretching, you've been standing seated for a long time. You can walk here. Don't remain seated and you want somebody to collect you. I would encourage you to walk and come and stick your sticky note. I encourage us to write as legible as possible so that we can read whatever you've written for us. And the language is okay. Maybe in Rukonjo, or if it's very good, she'll help us to interpret that one.
For those of us who are giving roles, there are those who are demanding different stickers for the. You can generalize. You can generalize and say, for internal stakeholders, these are the roles. For external stakeholders, these are the roles. I've been advised that for the roles, if you mention the environment officer, internal stakeholder, then when it gets to the roles, you write environment officer should do the mapping, should do this. If you have cited the health inspector, then when it comes to the roles, you indicate health inspector, do this, do this, do this. Let us make it short. Someone is saying it is going to be an essay. just outline the role. Just outline the roles. Tubikole mwabi kuhi tusoborera tutya mabi environment officer atolera nyachekera maete, for example. I request that we use shouldn't go AI. We shouldn't AI because events have been affecting us in our communities. Thereafter daily, and thereafter we have the information with us. Like someone was giving an excuse behind there that now the physical planner, what is the role of a physical planner? So we don't have to go to AI to ask what is the role of the environment officer and etc. When you're done, you lift your hand, I pick your sticker from your table.
Or if you don't want them to stretch it. Okay. You have been seated, no energizer, at least it's an energizer of walking here. Press your sticky note.
Okay, they are saying stretch. So when you're done, you stretch and go and stick your knot.
If you arrive and realize that you had made mistake using a wrong color, still place it where it is supposed to be. let's wind up. If you are somebody who naturally fears to come in front, you will be helpful. But you can take this opportunity to practice coming in Mr. Wagonza, I want to hand over to you.
Okay. Our DHO is going to take us through group formation so that after lunch we will go to our different groups and then you will be assigned questions to answer in those different groups. Over to you, DHO.
Yeah, thank you so much. We have seen our internal stakeholders and external there. This is part of the responsibility why we're here. I was requesting to see Dr. Sanaira. I don't know if he's around. Justin is around. Yes, then members are heading the different. First question. I want to go after explaining these questions. They are going to answer some of the concerns that I've been talking about. And then as you answer them, you will get a secretary and somebody guiding whom I've mentioned. Group one by the surveillance of person. Group one, good. These are your members. And then we are going to, you will read them. Group two, Sanairi, Dr. Sanairi will be able to read the names. And then group three, Cody will be able to names, and you get no. We have sorted them by title. But the questions are group one. I want to explain the questions. Group two. Group two. Group one. L. Do secondary care services align with the national health care system goals? So you need to know the national health care system goals and the secondary services that we offer align with the system. What are the key strengths and weaknesses of the district hospital or health centers within the broader system? The key, like a Wera hospital, what strength is there? What weaknesses do we feel we can handle in relation to what? Extreme weather events. Yes. Okay. He's suggesting that we project them so that even if I read them to the, but I've given copies as in your group. My issue was to explain them. But as you sit in the group, you will discuss them in detail. How do lower level health centers control secondary care deliver? What the challenges do? Lower level health care centers, these are the health center tools. health center 3s, 4s, all those are lower levels, apart from the general hospital and the district. What strategies could improve the integration of secondary care services into the national system? How can collaboration and communication between the different levels of care be strengthened? So, this group number 1, headed by Arafat, as you reach, you are going to subdivide into 2 groups to handle the 5 questions groups. Number 1 will remain in this hall. The lunch, you remain here, you organize, and group number 1, you will be able to read the name. Now, group number 2, headed by Corey, we are going to look at types of extreme weather events that have had the most significant impact on health systems in Kasese. How these historical events or environmental factors have shaped the prevalence of extreme weather events in Kasese district. How the frequency and intensity of these weather events have evolved over time in the district. What are the root causes of the driving extreme weather events? How have local communities traditionally responded to extreme weather events? There are also 5 questions. They will subdivide, and group 2 is sitting in the other hall. Just there is an executive hall as you get out here. There are seats inside there. I would prefer you go, these groups I'm giving the heads. I know you have laptops. Just go and make simple PowerPoints and put your, so that we don't. The heads, the names, the titles are there. They are going to read for you. Group 3, headed by Dr. Akan, Dr. Sanaid. If he is not around, Dr. Sanaid is around. Your group is, how would you describe the current level of awareness about extreme weather events within health facilities in Kasese? How do extreme weather events affect healthcare delivery system, infrastructure, and staff? What barriers prevent deeper institutional understanding of extreme weather events? What practical steps could help health institutions better acknowledge and respond to extreme weather events? Are there examples where extreme weather events were successfully recognized, mitigated in healthcare settings? So this is group 3 for Dr. Sanaid. And the groups are selected. They are I'm going to be helped by our surveillance focal person to read the titles of the people who are in each group. So that the members, group 3, Dr. Sanaid, stand up for recognition as they read you. Group 2, Mr. Kohli. Then group 1 is around. Then for the facilitators, we shall see how, so Paul is part of the facilitators, but we saw him prudent to be part of heading a group to guide it. So for the facilitators around, from Mast and myself, we shall rotate around. So you can read the titles of the groups.
Yeah. Arafat, before you come in, you have had our DHO read the questions. Please don't worry. We have most of the questions on paper. We shall distribute them according to the groups. Thank you.
Okay, thank you very much for the clarification. So I'm going to read the members of Group 1. Group 1, we have the District Health Officer. We have the Assistant DHO Health and Environment. We have the biostatician. We have the District Surveillance Officer. We have Kilembe Health Center 2. We have Isule. We have Charumba PHC. We have Karusandara Health Center 3. We have Kanamba. We have Kilembe Health Center 4. We have patient representatives. We have Kilembe, we have Isule, we have Charumba, we have Kanamba, And we have Media, Messiah, and then Light FM. Those are the members who will be in our group, and we shall stay here. Thank you.
Yes.
Excuse me, members. Orusungura makanyerera mweru mwenu. Ngarias. Aha, so ngarias sava. Russia kana ya norwed. Russia kana no rukonzo. Orusungura makanyerera sikwache neba net. So ukasoma mena, uwabi unemsoma uno mwa rukonzo. Health center 3 unemu bwa utere ono ya kasa. Sikwache ne.
Okay, group 2, the district officials, technical officials, Murikao, in charge of health. Who's the cow in charge of health? Okay, pass.
Okay, members, I wish to recognize the presence of Kao, he's amidst us. He will be with us as we continue discussing in our group. Thank you. Or you can go ahead.
Thank you, because I'm also a participant to welcome the cow when the organizers are around. So, cow in charge of health, then another district technical official, the senior environment officer. Environment officer, I think it is Mugume, sorry, it's the Olive Mask Olive. Then we have the district community development officer, DCDO, sub-county leaders of LC3. We have Burembia division chair, Mariba sub-county chair, Karusandara sub-county chair, then Charumba town council chair. Municipality leader, Mayor Kasese municipality, health facility in charge, that's Kilembe Mines Hospital. Partner NGO, we have Red Cross, Fura coordinator, Caritas Kasese, Save the Children. Security representative, resident district commissioner. Then we have medical director, Owebwera Hospital, Rukoki Hospital, St. Paul's Hospital, and Kasese Hospital. The media, we have Kasese Guide Radio. Then the senior human resource, MGO is what? MGO. The senior health resource, human resource. Yeah. Babu, about to be another group, air covered. So after lunch, I don't know what to pick a high. Up or down? All right, all right. After this beautiful girl is having food, then you just enter. Okay. Yes, what vertical? Group 3. Group 2, you follow Kwama.
Here, I'm here. Yeah.
Group 3, we have the district planner, stock disaster coordinator, district engineer, Kasese municipal health officer, Karumba Health Center 3, government, Sandara Health Center 3, Air, emergency relief desk, Rwenzori Rural Health Services, ED. Then we have UNCDF, climate change specialist, Ngabwa Rwenzori Minister of Health, St. John's Ambulance, area Commissioner Kasese, then UBC Ngeya, FM Assistant Manager, and then Dr. Tony and myself. Thank you.
Group 3 you have had. Group 3, you are sitting in the shade. You are going to enjoy the environment outside. Those who are missing, you are joining group 3. Those who are missing, you are joining group 3. It has less. So, ladies and gentlemen, I still once again request, on behalf of the district health office, I once again welcome our chief administrative officer, who was represented in the morning by the human resource officer. He has personally arrived. He saw it prudent to come and have a word with us. And he has a minister from Central who has arrived in the district, but he thought, let me come and greet these participants, these officers, and go back. So, our chief administrative officer, we are here with the Mbarara University of Science and Technology, basically for a Reshape project that is coming to I think he's already explaining the whole list, but my work was to welcome you and thank you for coming. He's having a greeting to us and thanking you for coming. Then after that, we go for lunch. Just switch off to your groups.
Thank you very much. Are you the masters of ceremonies? No. Is here for DHO. I greet you all. I will not manage the protocol since I was not here when we were standing. But I came to show support. That support shape, which has come to intervene in so many areas where disasters are concerned. I happened to be in a class where disaster was being taught, but the definition was not clear. It depends on the ability to cope. And then an example is, if the owner of link buses has one of them stolen or one of them crashing into ashes, and a banana pusher has one of the tires of a bicycle burst, to the family, which one is more of a disaster than the other? The link bus may call over an insurance to replace, but the family of a matoke pusher having the front tire bursting, the following day people can have no food to eat. So when one calls something a disaster, it is relative. What is a disaster to you may not be a disaster. So when we talk of disasters here, it depends on our resilience and ability to cope. So when a team like this one comes and they say, let us plan and mitigate the disaster, you are warmly welcome. When I came here, I was promised to see the floods on 21st of May. I have not seen. I think this year is different. I was told if you want to see floods in Kasese, you wait 21st May. 21st May first. I have not seen flooding. Flooding has been here for years, but we are not prepared for flooding ever since. We get disasters all the time. But I think this time we shall mitigate them. Yesterday I was taken to see the project of bamboo planting somewhere to mitigate. And it is doing very well. So when you come here, you have to show support, that we are grateful that you have come to organize us to mitigate the problems coming out of it. I've been informed that the health centers are affected by not the floods directly, but the flooding of patients to the health facilities as a result of flood. So you are here for that purpose to get used to the system, and we are grateful that we are all invited and honored the invitation. All of you are here. So take time, concentrate, be both here physically and psychologically, so that you come up with good plans to mitigate the disasters. We trust to have good brains in it. Therefore, when all of you combine, we cannot fail it with a plan which can pass. And if the funders are also here willing to fund the plan, then we shall see Kasese moving forward. I also managed yesterday to see one of the schools where I found 160 pupils in one school with 60 desks. Who knows that school? It is SDA in Bwesumbu. 60 desks in a school. We realized to the community to mobilize themselves to support the school or to send their children. How can a big school have only 160 when most of the children are in homes? Two, my team was surprised, meaning they don't usually go there to see what is there. But the situation is not good. We needed to mobilize the community. If all of them go to school, I think they can join us to plan for mitigating disaster. I thank you for giving me this opportunity. To you all, good deliberations and concentration so that your plan can be relevant to the problems we face. I thank you.
Thank you so much, Bonakao. Bonakao, I want to introduce you, the man behind this project, Professor Edgar over there, is the one who has brought us here today. Yeah, thank you so much. Thank you so much. Yeah, so we will be heading for lunch, and from there, we'll get into our groups. We have the questions with us, so kindly, for the groups, please contact us for the more questions so that we can all surely be on the same page. So we are going to officially invite you, Kao, for lunch. Yeah, so Oliver will be leading you to the table. You're welcome, sir. And then the rest of us will follow and enjoy our lunch. And from there, we'll have the group discussions or participation. Thank you. I've been guided that as we wait for the cow to join the table, we are going to commit ourselves to the Lord. And Mr. Wachiwanahi, you've been chosen to lead the prayer for the lunch.
Tumakusimanya mwanga wenda mbeno yatwa maendeleo yatunga kalyo mpaka tubera kamwasa kandi no muri tukende mu discussion iri intensive kutuya maezi tukere bana bera handeka kandi nebe tukere bera bamwaso amasabe byabo Yesu Kristo kama
cancer, body diseases, going to the health unit, you may not think of malaria happening. From that, those floods, you may not think of accessibility to the health facilities that may be. They are affected that now if the river is flooded, you can't cross to go and seek health facilities. They may not know that. They just think it is as what? They may think it is just it is not. They may not relate it to health, but they know it is there, but they may not specifically related to the health facilities.
No, actually, mine is an inquiry in regard to the question. Are we looking at the residents around the facility, or because here they are saying within health facilities in Kasese district? So which kind of people are we looking at here?
The health workers, yes.
And the residents of
Yeah,
those areas.
within health facilities. How would you describe the current level of awareness about extreme weather events within health facilities?
Within?
In Kasese district.
So I think those are the staff.
The staffs. Yes. They may not know that they have not gotten enough patients because of the weather changes. Or they may not know all those, but that's why I say within the health facilities.
So I think it is low.
It is low. Then, of course, the second question is, how do extreme weather effects affect health delivery system, infrastructure, and staff? Now that's what I've been talking about. How do extreme weather effects affect health delivery systems? We shall begin with the delivery system. Then from there go to the infrastructure. Then later we'll also look at the effects of extreme weather events on the staffs. Let us begin with the healthcare delivery systems.
Deliverers in medical supplies.
Medical supplies. Delivery system, health supplies, referrals, activities, immunization, and so on, those activities. Anyone with the contribution to that? I'm trying to answer that question. Yes, Dr. Tony.
Thank you, Chairperson. Looking at the second question, how do extreme weather events affect healthcare delivery system?
No, it's okay. Name public health
example.
So, public health act. It is mandatory.
If so, this is mandatory or yeah?
What the next thing was
exists
like
for
existing support. Existing support, then origin.
Human resource training.
Secretary does not talk. Yes, the points on the right there.
So, when the Minister of Disaster Preparedness, now you say
We have the
OPM,
the disaster response plan. It's an existing guideline.
It's not a policy.
It's not a policy.
It's a guideline.
Yeah, the disaster response plans. Those ones are optional.
They said existing policies or regulations.
Yes. Then we also have the building control regulations. It's commenting that where to build so that we avoid
eritendimba chitya chitu mwabika mu nyumba kasakumbawala
abasha municipality bakakolesa yaki that urban thing
ebintu binendi
that is a mandate. There is the urban authorities act.
Just building something there. But the public health act, engineers, they dictate over.
So Hamed, what support exists?
ambaye ebihungu byenanga mukanisa nibwahera mbarasha mukamba bagonza wamaya bagonza kauye yunem
hi
Sorry, my group one.
kaunem district
DHO is there.
DHO are normally mu group one.
Kanagalo ni list bag ya era. Was supposed to be and concentrate district health officer, DHO environmental health. Jenga Saram, Jengalwem, Ramaya Bandika Numpeni.
Technical people.
So we have started with the act, Public Health Act that which one? Hey.
Thank you.
Thank you very much. I welcome you today, and I am happy as part of Mbara University and the project. We are here in Kasese undergoing a data collection workshop on resilience of health systems in relation to extreme weather events, in particular the floods. So I'm here with a colleague and brother from St. John Ambulance. You're very welcome.
Thank you.
Introduce yourself to our listeners.
Oh, please, thank you so much. I feel very honored to have been part of this workshop because it's in line with our cause for establishment. My name is Julius are my names. I work as a dispatch officer for St. John Ambulance. Thank you, just for now.
Yes, as a dispatch officer for St. John Ambulance, what is St. John Ambulance in relation to disaster management, especially what happens as you are in Kasese, where we know the number of floods annually? What do you do
So
with
basically,
these floods?
Oh, thank you. So possibly before I go into that, I would first maybe want to give you a highlight about St. John Ambulance Kasese. St. John Ambulance Kasese is an affiliate of the international and national body, whose major objective is basically saving lives. We are a humanitarian organization and not for profit making. When it comes to climate change and resilience, we as St. John are always first responders in most of these emergencies. And on record, we have attended to almost all the emergencies that have happened in this district. So during these climate change related, impacts, like during the floods, our cause is always to partner with other stakeholders and the district to ensure that we respond to save life.
So give us an experience of some of these rescue missions, which has been the most severe that you can recollect?
All right. If I would recall the 2013 floods that happened in Kilembe alongside River Nyamwamba, when it came to the hospital, we had a very big challenge because it happened so suddenly, and we had to mobilize both human resource, and even the ambulance, kind of fuel. So getting to the site, we're all in fear. The hospital was all flooded, and the magnitude of the number of patients was really too much for us compared to the capacity that we have at the moment. Yes.
So what is a typical rescue mission after you have dispatched or received information? How do you plan your dispatch?
So usually when we receive information, I as a dispatch officer, my major task is to make sure that I call in a driver. At the moment, we don't have a permanent driver. So sometimes we have to use, we have to pick up from the neighboring, maybe, kind of companies to ensure that we get to that point.
Yeah.
But then also, when we're moving with the ambulance, we have trained volunteers in first aid. So those ones also come on board with us in the ambulance. So when we're carrying out most of these rescue missions, our members or the volunteers that we use have some canon knowledge in first aid and are able to do some tangible work.
How does St. John manage its activities? How do you manage to do all this voluntary work in the community? What are some of your challenges, especially in relation to resilience of health centers, particularly in periods of these extreme weather events?
Okay. As a part of our interventions, we have a training service where we do proposals to companies, and then these companies facilitate us with just some little bit of, logistics to enable us to develop like certificates in first aid, to enable us also be able to meet the allowances of these trainers. So in that sector of service delivery, we are partly supported by the clients who seek our services. However, overall, we fully survive on donations from well-wishers, and we receive some very little from our national headquarters.
Okay.
Yes.
What is as we conclude, your advice and guidance on managing floods, particularly around health centers. What is your take on ensuring, as our workshop here today is trying to find consensus on how to ensure that we can keep health services functioning during and after floods?
Yes, well, thank you. I will give an example of Kilembe Hospital. When it flooded, Kilembe shifted from its Kilembe site and was brought down to the Catholic diocese, where they thought was a safer haven. And if it hadn't been that they had a plan in place in case of such a disaster, then it would have been very difficult for patients who were in that hospital to be immediately evacuated to other health centers, because it was something that always comes that is sudden and unexpected.
Okay.
Yes.
You mentioned a plan.
Yes.
Is there a disaster plan that you are aware of in Kasese with regard to these extreme weather events?
Okay. Well, as far as I'm informed, St. John Ambulance is part of the district disaster management committee.
Okay.
We have a sitting on that committee, and this committee is in place actually. So I suppose if you're trying to maybe dig deeper, I would say that that plan is there.
Okay.
Yeah, there's a district disaster management plan,
Okay.
2021 to 2025.
Okay.
Yes.
So finally, what is your comment about the workshop we have held here at Rwenzori International Hotel as we close our interview?
Well, to comment about the workshop today, first of all, like I did say at the start, I was so privileged and honored to have been part of it. And I think it has come timely, because whereas we have these disasters that keep on coming year after year, I am not yet convinced that the strategies that we have put in place are actually going to be the ones that are going to address this problem. Because every time there's a flood, people lose property, people lose lives. Although of the recent one, we've not been having, we've not been seeing lives being lost, but about the strategies, I don't seem to be seeing a fully fledged strategy at the moment.
Okay.
Yes.
And the very final one, as a dispatch officer, tell us about your ambulance.
So now about our ambulance, we feel we are not yet fully supported to be able to operate this ambulance. Because like I did tell you, we do not have a functional budget for it. We only rely on handouts. Like if there's an occasion, say like it's going to be the marathon that is coming very, very soon, we write to those organizers. And those organizers only meet expenses for the day's allowance and the fuel. But beyond that, we don't have yet, I would say, we don't have a permanent donor who is able to manage, who is able to support us to manage the ambulance.
Yes. So we want to thank you very much, but I would like you, as we completely close, just mention the names of your heroes as members of St. John Ambulance in Kasese.
The heroes, like I would say, the same founder of St. John Ambulance Kasese is the same old man by the names of Dr. John Baluku, who also introduced Red Cross Uganda in Kasese. He was the first gentleman to operate a private medical clinic
in
Kasese. He is the same person that is the brain behind Community Aid Foundation. It is an organization that is currently initiating or currently implementing on a resilient project of climate change, but specifically targeting older women that were affected by the recent landslides and floods along River Nyamwamba.
Okay.
Yes.
So you will greet Mzee Baluku for us.
Oh, please.
And we continue to pray for his resilience as he takes on a lot of volunteering work.
Oh,
thank you very much.
Please.
Thank you.
Most thanks.
Yeah.
Yes. Thank you. Maybe. For now.
very much. Good afternoon.
Good afternoon.
We are happy to host Professor Edgar Mlogo. Please tell us about this project called Reshape that has brought us to Kasese today.
Okay, so Reshape is a study that was evolved from observations that have been made globally, that as a result of climate change, we have extreme weather events that are affecting healthcare systems in particularly low, medium income countries. And because of this, this study was conceived as a of understanding health systems within setups like Uganda and how these extreme weather events, the focus is on flooding, how they impact on healthcare systems in countries like Uganda. So we have convened a workshop in Kasese district because, as you may well know, Kasese district has been affected quite drastically by floods in recent years, and it presents a very good case study area.
Okay, thank you so much for telling us and taking us through what Reshape is. This workshop, what are the core objectives of this workshop?
So the core objectives of this workshop are to gain insights on the healthcare system in Kasese district, of course, as I have said before, that is affected from time to time by flooding, and how the healthcare system has responded to these extreme weather events such as flooding. So we have people drawn from the health sector in this district and from other departments that are responsible for responses related to extreme weather events. And from them we hope to gain insight in how this has all, the response has been in this district following this flooding or extreme weather events.
Okay.
Yes.
As we conclude our interview, what is the way forward, given that you've had multiple stakeholders here? We've been able to see district leaders, we've been to see health facility managers, we've seen patient representatives, members of the media, and also other members of the community, with a number of people coming from various other NGOs and different. Are all those the stakeholders that will make a difference? What is the way forward?
So this workshop is the first of a series of workshops. This workshop has mainly been about information sharing and consensus building on the kinds of extreme weather events that Kasese is experiencing. In addition, understanding how the health system has responded. And so once we have done a synthesis of this information, we will then come back to these key stakeholders and look at things that we can do to ensure that there is the response we develop interventions for appropriate response and to these extreme weather events, and ensure that the health system within this district is more resilient when these events happen.
Okay.
Yes.
Thank you so much, Professor Edgar Mlogo, for giving us an insight into what the workshop is being held here today at the Renzori International Hotel, Kasese. Thank you.
Thank you, Dennis.
to our communities. Because maybe one way to bring understanding in our institutions is also maybe to have deliberate airs, talks about these events. But I think for the media, it's much more of commercial, so they look at where they benefit from. So I think the media yeah, so publication of these things, the eye.
Just hold on, hold on. Thank you very much. Good afternoon, Mr. Chairman.
Good afternoon, sir.
Thank you for being with us this short interview.
Yes.
I would like our viewers to get to know you in your own words. How would you introduce yourself?
Yes, please. My name is Bomera Richard. I am a chairman of C3 for Nyamwamba Division. Nyamwamba Division is found along River Nyamwamba. I'm also the chairperson for the Nyamwamba Catchment Management Committee, which was established by the Ministry of Water and Environment, specifically to link the communities to the ministry when it comes to issues to do with the disaster and also the well-being of the people using River Nyamwamba.
Mr. Chairman, thank you very much. Nyamwamba is a name in everybody's mouth or head when it comes to floods in Kasese district.
Yes.
What are some of the significant issues you can tell us about Nyamwamba, and why do we see so many floods around this river system? And what have been their effects, particularly in relation to health systems within Kasese?
Yeah, thank you very much. First of all, Nyamwamba River is a very huge river which bisects through Kasese municipality. It comes from Mount Rwenzori National Park at the Mountains of the Moon, at a place where there are glaciers, and it runs through the whole of Kasese municipality, and it pours into Lake George. And when you visit Nyamwamba during maybe dry season, you may think it is not supposed to misbehave and cause a lot of destructions like it does. But I can tell you, on the history of the whole of Africa, Nyamwamba is one of the most dangerous rivers that has caused so many problems in Kasese here. Basically, why does it do that? First of all, Nyamwamba has so many other rivers that join it in the mountains. And most of these rivers come from small hills And when it rains too much, there are a lot of landslides that take place up there, and then they just slide and take all the silt in the river of Nyamwamba. And it has very, very big boulders that can cause problems as they are rolling. And when these landslides join River Nyamwamba, then definitely it destroys the whole of its valley. So when it floods, it finds no valley, and therefore it just meanders on the surface and hence causing a lot of problems. Because I understand Nyamwamba has so far flooded 7 times. The first one was in 1955, the second was in 1964, the third was in 1973, then the fourth was around 1980, the fifth was 2013, then the sixth was 2014, and the latest one was 2020. And every time it floods, it has to cause a lot of destruction. For example, in 1964, Kilembe Mines, by that time was still very, very active. It had put up a lot of infrastructure. So when it flooded, it has to cause a lot of problems. It swept away bridges in 1964. It also had to affect Kilembe Mines Hospital. But there was luck that by then Kilembe Mines was still very active. It had to develop a master plan for the management of Nyamwamba. So it had to reconstruct bridges. Kilembe Mines had to reconstruct also the hospital. Now, when it came back in 2013, it destroyed 9 bridges that were constructed during the Canadian time. Now, when these bridges were destroyed, definitely people found it difficult to access health services. And the other major issue that it caused, it had to destroy the staff quarters, all the staff units of Kilembe Mines Hospital. That was 2013 and 2014. So all the workers, the health workers at Kilembe Mines Hospital had to run away, and some lives were lost, and also some buildings were lost. Now in 2020, to be specific, it had to destroy a good number of infrastructure at the hospital, and also it led to the relocation of the hospital from the area to other areas. And as I speak now, because of that repeated kind of occurrences of disaster caused by Nyamwamba, the Ministry of Health had to suspend the medical supplies that were going to Kilembe Mines Hospital. And the catchment of that area, which is basically 6 sub-counties with a population of around 300,000 people, have remained without health services. Immunization that used to be carried out and implemented by Kilembe Mines Hospital, as I can speak from the year 2020, these are now 5 years. The mountainous areas are no longer accessing immunization services. And of course, you know what it means when the place can run without accessing immunization services. And also the other issue in addition to the floods, we have the land and the mudslides. Like I have already said, they have a connection to the Nyamwamba. Because we are living on the hills of Mount Rwenzori, when there are landslides and mudslides, definitely they destroy the road infrastructure. And when the road infrastructure has been destroyed, then definitely the people will not be able to access health services. And at some point, even the means of transport fails. Even if someone has maybe a motorcycle or even a vehicle, most of the pregnant mothers are being carried currently on a stretcher. And you know what it means, walking a distance of about 15 kilometers when you are carrying a pregnant mother who is going to deliver on a stretch and walking on foot. So these floods and the landslides, the mudslides have greatly affected service delivery. Previously in 1994, that is when Kasese district experienced a lot of mudslides in the areas of Charumba and also which are found on the slopes of Mount Rwenzori. We lost more than 100 people one day just because of those mudslides and landslides. And they were all feeding into 2 rivers, that is River Nyamwamba and River Nyamugasane, which are very deadly rivers, and they come from the same place. The other issue that has caused a lot of problems in Kasese here is the prolonged drought. We are living on the slopes of Mount Rwenzori National Park and Mount Rwenzori as a mountain, but we're also very, very close to the equator. So when the equator also misbehaves, then we expect a lot of prolonged drought. And when it happens, then definitely animals will die, and also the crops will not grow very well. And therefore, the people will have to experience a lot of malnutrition. So it is true that these natural hazards have affected health service delivery in this area, and hence affecting our population. And at the end of the day, it will result into deaths and also poverty, because people will not have the food, people will not be energetic to work, and when people don't access medical services, then definitely you expect a lot of poverty.
Okay.
Yes.
Thank you, Chairman. Now, clearly, the floods have affected Nyamwamba,
yes.
Nyamgasira have really been very difficult river systems. But you've given us a history of all these floods.
Yes.
What have local communities in the past and maybe even present, what are those traditions that people have locally innovated or locally taken from the past that what have the people locally used to respond to these floods, these extreme weather events, be it the mudslides? And do you think that we have what worked in the past still possible to work going forward?
Yes. First of all, like I've already told you, Nyamwamba started flooding in the 1950s. By that time, we had no very many religion denominations.
Okay.
And we had the culture. We had the culture whereby we had our native doctors, and where we believed that when the river behaves like that, then it means the small gods in the mountains and also in families have become annoyed because of certain things that happen. Okay. Because there are certain things, the don'ts and the do's, which yes. were not supposed to be done. Now, whenever it happened like that in the past, then we had some old men who could now
intervene.
Yes, could intervene. They carry out offerings, they cleanse the area, and the river stabilizes. Then after that, when following the introduction, now the coming in of the Canadians, who were specifically the ones managing
the Kilembe
mines, they came in with the new methods, the new technology.
Okay.
For them, they were desilting the river. Every year, they brought in machines that used to desilt the river so as to prepare the river course. And they could do it twice in a year, because it is believed that here in the Rwenzoris, the seasons are always two. We expect a lot of heavy rains in May and also in October, November. So in March, between March and January, they used to desilt the river. They could move in around excavators, like 3 excavators, the bulldozers, so that the river could remain deep in the valley. So that was a new method that was brought in by the Canadians. Definitely the other method was that by that time, our people had not yet begun settling in the valleys. They were staying on the hills, and the population was still very small,
yes.
and we used to tell them what to do. So people were not supposed to cultivate wrongly on the slopes. So those are some of the traditional methods, and every home by then, it had not less than 5 very big back trees. And okay. these back trees used to conserve the soil, and they could also break down the running waters from joining River Nyamwamba directly. So all of these, because of introduction of other methods, now the population has become very big, and also some government policies have given a lot of rights and the powers to every community, because by that time, traditionally, when you have a back tree at your place, you are not supposed to cut it down without the approval of the chief elder in the area. But today they are no longer working. So traditionally, those were some of the methods that could help us to tame River Nyamwamba. Yes, and now today, basically I can say that currently we are relying on the government. But we are also very happy that our communities have also expressed a lot, and they have thought of what to do. Like right now, we have had structures on the ground. Every village that lives along River Nyamwamba, at least there is a disaster committee at every village. And these people have undergone a lot of training specifically to help the people in case of any emergencies, to rescue them, and also to help, like if there has been a mudslide, those groups of people gather at one's home and they make sure they remove every silt that will have caused problems at the home. So basically, locally, that is what we do. And then the other issue that we do is definitely to engage government and also other partners, because currently, because of the introduction of technology, and now that the silt has become too much and Nyamwamba has become a very big threat, we feel our capacities as locals is now little and minimal. Therefore, we are working hard to engage government and other development partners. And we are very thankful that at least most of the development partners, together with government, they have come to our rescue. As I speak now, we are working on desilting the river. We had in phase 1, which we have already finished. It was covering a distance of 5.4 kilometers. We got money from the World Bank. Now, as I speak now, we have already a project going on. The feasibility studies of phase 2 has been concluded and the report is about to be presented. We also have other partners like Mountains of the Mini University and also Uganda Matters University. They are getting support from other communities in Belgium. They are also helping us. They have so installed a machine that is used to monitor the behavior of the river. So it is monitoring the behavior of the river and then feeding into their communication networks, and they also tell us every time the river misbehaves, at least. Then 2, we also got support from World Food Program through Uganda Meteorological Authority. They have also installed a rain gauge at Kilembe Mines Hospital for purposely to monitor the rains in the atmosphere and also connect to the early warning equipment which is put in the deep mountain of River Nyamwamba to help us at least get information on whatever is going to happen. We have also engaged other partners like the power generating plants that are working along River Nyamwamba. They have also helped us. So as communities, we have brought on board so many players specifically to help in mitigating disaster so that our people can resiliently live along River Nyamwamba.
Okay.
Yes.
Mr. Chairman, as we conclude our interview,
yes,
the project by Mbarara University of Science and Technology,
yes,
this project called Reshape.
Yes.
What are your, how do you understand the objectives of this project, and what is it that you feel it will bring on board as another partner?
First of all, I am a participant in that. I've been deeply involved as a chairman of the area of the local government and also the chairperson of the Catchment Management Committee. I was brought on board. And as I speak now, I have been elected as a chairperson of the advisory committee for the implementation of that project.
Yes.
We are expecting a lot because first of all, the machines have been installed. Here we have joined the 2 valleys, River Nyamugasane and River Nyamwamba. We are working in collaboration. And as I speak now, we have installed those monitoring machines, one for the rain gauge and also one for definitely, monitoring the behavior of the river. Yes. Now, what next? They are promising us that is a big project. It is going to run for 10 years. Now they are going to help and educate our people on how they can live along River Nyamwamba without destroying the catchment as they are doing their own works. So we are going to go into conservation ventures to an extent that they are also going to help us with the seedlings, to help in the development of conservation, promotion of conservation, and also value addition. So that we are going to plant fruit trees to conserve the environment, but also to help the communities to get what to eat and also what to sell. Okay. And above all, when they put in place some machines to purposely to add value on what the communities are going to produce, definitely we shall have to gain a lot. Okay. So we are expectant and we are thankful to all those partners.
Okay.
Yes.
Mr. Chairman, finally, what is your advice to your people, the people that you lead in around the Nyamwamba River? What is your advice in relation to the activities of this river, the risks, and how people can mitigate all these challenges in special relationship with access and continuity of health services whenever we get these unfortunate incidents of flooding?
My first advice goes to government. Government, like I told you, it is the one which deactivated the medical supply to Kilembe Mines Hospital. but we are thankful to it again that it had to invest a lot of money, like 19 billion. They are also going to invest 90 billion Uganda shillings. But then my advice goes to them that they should restore the hospital, because we cannot have the people live without medical services. And also our people are wondering how government is spending close to 100 billion just working on the river, but without spending on the medical services. You spend 100 billion on the river, but you don't spend 300 million on health services. So my first advice goes to government, that government needs to be considerate and restore the hospital. Now the second advice goes to my community members, that like we have always told them on how to live along the river, they should adhere to the guidance we are giving to them, and also the guidance offered by the development partners. Lastly, I also want to advise my community members that let us desist from encroaching on the catchment of the river. Once we do that, I know previously there was no encroachment. Even if it was there by Kilembe Mines, and whereby it had the responsibility of desilting the river in case of anything. But now that we are no longer having Kilembe Mines desilting the river, my advice is that the people should desist from encroaching on the catchment. Thank you so much.
Thank you very much, Chairman. Thank you very much. Yeah. Okay. Good afternoon.
Good afternoon, sir.
Yes, it's nice to host you today in Kasese at the Renzori International Hotel.
You're welcome.
I would ask you to introduce yourself to our viewers. Yes.
Yeah, thank you so much, my colleague from MAST.
Yes.
My name is Vagonza Stephen. I work as Assistant District Health Officer, Environmental Health, and I'm on the disaster management team for the district. For today, I'm both representing my DHO, Dr. Amon Bambare, and myself as one of the facilitators of today's training.
Yes.
Yes.
So thank you very much, Mr. Bagonza.
Yes.
This workshop today in Kasese, in relation to the Reshape project and its objectives and ideals, what is your take about the issues that the Reshape project is trying to look into in relation to your experience in Kasese?
Yeah, in relation to my experience in Kasese, I've worked in this district for quite a number of years, and now this is my 25th year in Kasese, working with the district local government.
Okay.
And I have actually experienced a lot of disasters and mainly floods that have affected the health systems in the district.
Yes.
And being born of the soil, I know what actually happened. In fact, I'm from Kilembe.
Okay.
I'm born in Kilembe, where much of the disasters like floods have actually destroyed and have actually affected our populations.
Yes.
So when you look at the Reshape project, it actually came in time and actually so wanting, because the year we have been with them, having marked some of the facilities like Kilembe, former Kilembe Hospital, now Kilembe Community Hospital, the Kilembe Health Center 2, Karusandara. These are the areas which were mostly hit by floods. And these floods have caused a lot of havoc to the population. And in areas of health, when you look at floods and what happens, like when our Kilembe Mines Hospital was destroyed, there was a lot of effect to the population. Pregnant mothers suffered. Mothers were being carried from the mountains of Kilembe. Instead of reaching the hospital, they were being brought to Kasese town. So transport became a challenge. We started registering high number of maternal deaths. We registered perinatal deaths during the season, and it had a lot of effect on health. So I feel this project is going to do a lot for us. And now when we go down to sensitizing communities and telling them the after flood effects in regard to health, and they are able to know what can be done, where we're giving people the early warning signs, telling them these floods have an effect to us. Can you find a way to either reallocate or find better places to live in for a healthy living? So when you look at these floods in the district of Kasese, the relationship with health, I have given already one example, but other issues are like destruction of the facilities themselves.
Okay, the health facilities.
Like Lembe, like Karusandara Health Center.
Yes.
Where people are getting services. There is destruction of water sources.
Okay.
Where people are supposed to be getting safe water. Then even the water sources existing get contaminated because the sanitary facilities are destroyed, feces washed into the contaminated water sources, and then water becomes a problem. Then we begin getting now issues of diarrheal diseases happening because of the water what? Because of the water systems. And when it comes now to formation of camps, like this camp in Muhocha.
Yes.
Where we had challenges in Karusandara here, I mean in town.
Yes.
Kanyangea population shifting, people in the camp. So services at Muhocha Health Center, the targeted population to be served increased.
Okay.
We started getting shortages of drugs. Shortages of drugs because of the shifting population. Then in the camp itself, where you find now children, parents in one small hut.
Yes.
Issues of teenage pregnancy begin occurring.
Yes. Challenges of reproduction health.
Reproductive health challenges. In fact,
Terrible.
there are terrible challenges in reproductive health, which are many. So you find the whole system affecting the what? The population.
Okay.
Yeah.
Well, you really paint a very difficult picture, but that is, do we have consensus that that is what is happening?
Yes.
Do we believe that is the consensus? And what is the way forward as we conclude?
As we go, the way forward basically, what I'm saying is actually what is happening in the district. And the truth is that if you moved down now to the camp of Muhocha,
yes,
you can get an experience where we are busy now supplying the water purifiers. The Prime Minister's office has come to help us with now the food, which is also, there is a lot of food shortage, where we expect now children malnutrition to come up. And these issues are actually happening and on the ground. So we feel this Reshape project, this study, if well conducted and the results come out properly. And then we lay strategies for solving some of the interventions that we may think will actually help us do much. As a district, we have actually the human resource trained.
Okay.
We have the disaster management committee for the district. We have the response. In the DHO's office, we have made the response plans following disasters and outbreaks. We have a well-trained DHT members who are trained in disaster management and what can be done. We also have a program of continuity of essential services. The post-secondary, the secondary services to offer even after floods. Because there are some activities that we do that are not planned within the system, but just emerge out of floods. For example, when floods occurred in Kilembe, we had to do extended outreaches, which were not formally in plan. We had to do risk assessment of the vulnerable populations, not in plan. So you find secondary services coming in, which we implement, but not in plan. Yes. So we have actually done much for our district, and Kasese has become to be known as one of the districts naturally owned of these disasters. Change of weather, extreme weather events. Extreme weather events have become a problem in Kasese, and mainly in 2 seasons. During the months of the September, October, November, December rains. Then the March, April rains. So these seasons affect much. So this is where we need to have programs in place to help us solve that problem. Yes.
Thank you very much, Mr. Bagonza. Thank you for letting us know. And we believe that with concerted effort we will get consensus.
Yes.
We will bring different stakeholders together.
True,
and
true.
that with information,
yeah,
it is possible to have interventions that are critical and exact.
And as an officer, we are actually happy.
Yes.
And we thank you so much for bringing these stakeholders together.
Yes.
Where we have now met with the RDC,
Yes.
the COW, the
Yes.
chairman has arrived.
Yes.
Technical persons from health facilities.
Yes.
Beneficiaries from the affected sub-counties.
Yes.
Actually, this stakeholders engagement today is of too much beneficial to us, and we are so grateful.
Okay.
Yes.
Thank you very much. Thank you, Mr. Bagonza.
Okay.
Yes, in the next 3 minutes we should have our summary. Can I get the registration list? I hope everybody's name.
Registered, we are
Please.
We have registered.
Let us conclude. We shall make a presentation of a bullet form, just briefly,
Yeah.
not
We are
too much
supposed to be 14,
explanation.
only 13 of people have registered. The percentage is
Okay. Thank you. Let's conclude.
Thank you, Chairperson.
Thank you very much for attending this discussion.
Thank you, Chair. You take.
Avoid for commission status. Mungakangana abantu abafute dining lesi wakati kuhani yake. Abantu bani employee nangana abantu barote project vacation abantu clinic kabisa.
Ladies and gentlemen, kindly let's return so that we can conclude our day. We have discussed what we have is sufficient for today. I request that the Secretary of every team or anyone you have chosen, please have your bulleted report to be presented in about under 2 minutes. We will capture the information. We just need you to state what your discussion has brought out. We kindly ask you to converge so that we can get into our closing ceremony. I beg your indulgence that we have stayed long. Let's come to our closing ceremony. Please, the team outside. Oliver, don't leave anyone behind. Arafat, lead us.
Members, I think you should come in so that we wind up. Otherwise, we need to go home. Some of us were already homesick. So, my dear participants, amid stars, I wish to recognize my fellow participants. Amid stars, I wish to recognize the presence of the Vice Chairperson of Kasese District Local Government, who has come to bless our interaction that we are having. Bwana Chairperson, we have been having the interactions this morning, and you found that we are really winding up, but I'm sure that you'll just join us from wherever you find us, and I'm sure we will be able to explain to you a couple of things, what we are doing. Sir, we are really dealing with the health system resilience in the context of extreme weather events that keep grappling our district, and I'm sure you are very aware of the floods that we continue experiencing in our district. Because time is not our best friend, I would wish to say that whatever team is ready to present to us, it may not matter the order. Otherwise, time is not our best friend. Who are the members of Group 1? Group 1 members, our secretary. The members of Group 2, are you ready, Group 2? Olive, you are ready? Group 2. Group 3. Dr. Sanai, you are ready? Dr. Baluku. Technology team, come and support us. Is it compatible with the work we have? Members, please enter in the hall. Those who are still outside.
Yeah, good evening, everybody. Yeah, we just need to look at the questions. We are going to be brief, and I would expect you to give additions, subtractions, and we call it an evening for us. That is the first question. And it's saying, how do you describe the current level of awareness about adverse weather events within health facilities in the district? The answer, we tried to make it as we divided it low, medium, and high. Therefore, our answer was that the health units, the current level of awareness is low. We also substituted it that only health facilities which are along the places which have gotten the disasters take it serious, that there are events related to the adverse weather, they are related to weather. And those who are not near the health unit, near the place which is prone to which is not near the place where the adverse weather event has occurred, will not take it serious and will not know that it is something that is even affecting their health system and other things. Like in Kilembe, they were able to know about it and they can easily describe exactly how it has affected them in details. But if you go to Mahango, they may not know exactly what has happened due to the adverse weather events. And then the second question says, how do adverse weather events affect the health care delivery systems, infrastructure, and staff? We divided it into having delivery systems. Then we also talked about how it affects the infrastructure and the staff. About the delivery systems, our reference was Kilembe Hospital, and we said that but this one, there was a problem to do with accessibility, where people who were staying, say, in Mbunga, those who are staying in Masule, those who could not access will not come for a service because of the adverse weather event that occurred there. We can give as many events that has occurred. People were giving examples of Karusandara, that even the health unit is up when there is flooding, it is surrounded with almost water, and people may not come to the health facility, and therefore the WHO principle of accessibility will not occur because of the adverse weather events. Then we are saying getting access to health facilities to be compromised. Then we say that okay, this was just an explanation. Then we said that sanitation infrastructure, like pit latrines, are washed away with the flood, with the landslides, and even some of them are submerged in water, and eventually the burden of diarrheal diseases and other things will increase. That is where we are saying that transmission of communicable diseases like malaria and other waterborne diseases will also increase as in the health delivery systems. And we also said some commodities, the pressure on some commodities like coartem, like mebendazole, metronidazole, and other things that are used in the treatment of those diseases related to diseases that are associated with adverse weather events, like breeding sites for mosquitoes increase. Then after some time, malaria incidence increases and eventually prevalence increases. Therefore, coartem use, if the government had budgeted, say, for certain doses of coartem for that village or for that health unit, it will be used up within a short time. Therefore, there will be pressure on the commodities. Then interruption also in the supply chain. Some places will not be accessed, will be cut off, and eventually the medicines will not be delivered to those places. Another
I think it is also goes to do with the straining on some partnerships. We are looking at the Kilembe Mines Hospital, which had a tripartite partnership, which had the church, it had the government, and then it had Kilembe Mines. Because of the repeated floods that occurred in Kilembe, then the church divorced itself. Then the government has also withdrawn. And eventually, Kilembe Mines Hospital, its status has reduced. Why am I saying it has reduced? Because the PHC that was going to, the dedicated funds that we are going to Kilembe are no longer going there. We are having we are considering Kilembe as a PNFP because of the church. That one, because of the withdrawal of the Catholic Church, it is no longer graded under PNFPs. Therefore, eventually, it is now the partnership disrupted because of the adverse weather event. Then, about infrastructure, we realized that Kilembe Mines lost Kilembe Mines Hospital lost its buildings. For those who knew Kilembe, most of the buildings were washed away. Then machines, those who were trying, when the floods came, those who were trying to help, some of them went with the machines. Those which were supposed to come to the dust, some of them ended up in other people's buildings, as in that. Then bridges that would be bringing patients to the hospital, that would be bringing, people would be using to cross to access the health facilities, were all washed away. And if you would have, say, pregnant mother laboring, say, just across, would take miles to reach the hospital, and even some lives will eventually be Will eventually be lost. Roads were cut off, especially those who go through Karusandara. Roads are normally cut off when it is the rainy season. Kilembe itself, the road was also cut off, and other places. In my place in Charumba, the road was also cut off. People who want to come to Kagando would take a long distance to drive a pregnant mother or a very sick child from Charumba to access the hospital in Kagando. Then electricity lines, and you know the cold chain system, drugs that are supposed to be kept under cold chain, they need constant power and other things. Therefore, all those things, lighting, autoclaving, all those things can be affected just by adverse weather event, and eventually, in the long run, even when you do an operation, you will easily get sepsis. But you may not easily connect sepsis to the adverse event that occurred in that place that you didn't sterilize your things. Therefore, electric lines, sewage line connections, sewage spilling, breaking down, spilling to the water bodies, and eventually people taking water and boiled water, and eventually end up with waterborne, water washed, and water-related diseases. Then the houses I've talked about. Then some centers lost their rooftops, their roofs, and eventually all the infrastructure was affected. The staffs were saying that the staff attendance to duty is low when there is an adverse weather event, and eventually someone who was supposed to attend to 20 mothers, if they are true and one has come, the other one has been blocked on another side of the river, or because of other events that occurred at his place, one person will work and eventually the attendance will be low. We are saying also the rhythm of work. If you are supposed to be at the center by 8 and then you are blocked with the river, or even you have heard that the river has burst its banks, eventually you may tend to wait and go at midday, and eventually the rhythm of work at the health unit will be affected just because of an adverse weather event. Then finance on the staffs, this can be explained in many ways. You can even say when people who are displaced like in Karusandara, if they are your relatives and you are a health worker,
and the government maybe has not provided, you won't allow them to suffer there, and you are a health worker and their relatives, you may need to pay for them. Then financial strains, diseases that come after the floods or come after any adverse weather event, you will need to pay to do some investigations. Some of them will be unnecessary investigation, some of them will be necessary, but trying to make sure you get the root cause, and eventually financial strain will come in. Psychological torture, yeah, of course, by those who have worked, for example, I've also worked there somehow. But when it rains and you hear any bang, you think it is again the floods are coming. You tend to work when you are almost stressed, thinking that anything can happen and your house may go. And eventually, I think we may need a mental health study to see the effects of on the psychological, mental status of individuals after floods. Like now we have, like professors already brought a concept, and that is one of the things that we may look at. The other question was, what are the barriers? What barriers prevent deeper institutional understanding of adverse weather events? Yeah, one of them we have said is lack of knowledge, that the people may not have they don't have the knowledge, that they may not connect other events to their day-to-day living in relation even to healthcare, what they live at. They just know Nyamwamba has flooded, and they may not know the effects, how to live and affect their revenue, how to affect their food production, how to live and affect the budget for the country in relation to that. Therefore, because of that, they may not really put much emphasis. Then cultural beliefs, we are like saying, some have, personally have moved throughout the country, even they have moved some countries out. All of us will have our own cultural beliefs. When the river Lake Nyamwamba breaks its banks, we have known the causes, as from the senior environmental officer. He was telling us, of course, from even geography and other things, but today we are refreshed about it. When we build in the water channel areas, river-based areas, when we grow crops along the river, when we cut trees, in other words, when the water base raises because of our human activities, eventually we have realized that the water, even some activities like bridge construction, of course, when you study physics, you realize the force over area. Then when you reduce the area of where the water is supposed to pass, then the force will be too much, and eventually the area after the bridge, the water will go with high pressure and eventually may destroy other things. And all those things, what activities. But people culturally don't look at those real causes of floods and other things. They tend to associate them to some god in the mountains, and eventually they fail to understand now the deeper scientific causes of what? Of floods. That's the one thing that we should look at. Then a political mindset. This one has looked at me. This mindset that there are some people who will not want things to be reported, bad events to be reported in their districts or sub-counties. And eventually, some of them may not think was general thinking that about the bad events that have occurred in their hospitals, and eventually people will not enter the real problem to do with adverse weather events, because they have been affected. Then information flow. We have said that adverse weather events. We have said adverse weather events information suppose will flow as the DHO was explaining, VHTs and so on. But you may find to Ministry of Health, may not report to agriculture, and eventually the information that had gone up may be distorted and the way it is reported may not reach the end, the way it came out from the what? From the source, and the effects will be distorted, and eventually people will give up. Then we talked about corruption. Corruption is to do with the money, people being given the money to come and do things in relation to mitigation, and the money is not used for that, which eventually things may not be done in the next. The same event will come and affect them, which has been sorted because someone went with the things that were supposed to have worked on it. Therefore, corruption. Publication, well done. That is the one, the report about floods, but the one who will articulate how it has affected the health and other programs is supposed to be the technical person. Those people are not there, and therefore they will say there were floods in Kasese. But how it has affected agriculture, the deeper understanding will not be well articulated. How it has affected health will not be articulated. Health promotion is not given priority. We know that we have curative and promotion. Health promotion is where Vagonza is the head of health promotion in the district, and each time the budget every year is cut, and eventually when money comes, the in charge will now look at more of curative and not articulate the causes of those other things, and therefore health promotion is not given priority in most cases. Then the budget allocation, I've already told about that. Then practical steps that would help institutions better knowledge and respond to it. We say creating awareness through advocacy, media, barazas, partnerships, and then put their website buildings. Building a good website that timely should always put success stories and events that have occurred in your place and how they have affected the community. People will. Then we said early warning signs. Those who were born before me, that Kilembe used to have early warning signs that they would know that floods, the river would burst its bank, and they already warned people before people lose their lives. Therefore, it is very important to look at that. Then strengthening the reporting system. We are saying the VHTs should be given indicators related to adverse weather events and in relation to the burden on the health delivery system. Then the capacity building. Then that is to do with the grazing staff and so on. Initiation of task forces to do with the disasters and where adverse weather events will come in every sub-county, not only waiting for an event to occur and then we start acting. We realized that the community development officer at the sub-county is overburdened. He has very many things that to do. Last one is examples where adverse weather events were successfully recognized, mitigated in health care settings in the Kasese district. We are privileged to be having the former BHO. He gave us an example where in some cases when he was in office, that when they would know when there is rain is coming, they will distribute chemicals for water purification to places like Karusandara, and then also they would also distribute mosquito nets to those places even before the flood, before the rain comes, in trying to make sure those things will not happen. Thank you very much.
Thank you.
The end.
A big hand clap for him. Thank you so much. Let's have Mr. Constantine for the group number 1. Thank you very much. Maybe I can start connecting for you as you are coming.
Okay, good afternoon to all of us. Once again, my name is Constantine Tembo. Here to present on behalf of Group 1.
Yeah, Mr. we shall be mindful of time. Thank you.
Okay, so our task was, if I can read it for the benefit of all of us, are there existing policies, regulations that mandate parts of the healthcare system, including the suppliers, to have operational continuity plans, personnel and resources for dealing with disruptions following extreme weather events? If so, are these provisions mandatory or optional? What support exists for their implementation and what is their origin? So we are going to discuss or to present in that kind of background. So we to answer that first question, if the regulation pressure policies this are guiding, if they do exist, is that yes, they are there. We have policies, we have regulations, we have guidelines, and from time to time, in case we are responding to anything, there will be guidelines even drafted to support us to respond to certain disruptions. So guidelines exist, and we are able, some of the guidelines that we have seen as health workers or with the other team, we have the Public Health Act, which is mandatory for everyone to be implemented. In terms of support, we have the human resource, we have our environmental health workers who are able to implement this Public Health Act. We have the VHTs who are also supporting us to implement, though with some challenges, but it originates from Ministry of Health. We have the National Environment Management Act, which is also mandatory, and in terms of the support, they have been able to sensitize our healthcare workers on disaster preparedness and also on duties. They have also been supportive in construction gabions along the river bank, so that along the river bank, so that employer mawa ametsa kolachi isa increasing akaenda mwa community kolachi isa increasing akaenda mwa communities. They have supported planting of bamboo trees to also protect land from being Authorities Act, which is also mandatory, and is supporting in physical planning for our health facilities. So we are guided by this, how to be located, originated from Ministry of Works. We have the National Health Policy, which clearly stipulates many things, but the current support is that it gives us strategic direction between our health workers to carry out offering our services. We are guided by the National Health Policy, and that originates from Ministry of Health. So next is how well do secondary care services align with the national health system goals? If you look at our strategic development goal number 3, is to ensure health lives and well-being for all at all ages. Okay, so we offer some extreme weather events. We still align ourselves to the goal. We can't do something that is outside, beyond the routine. There are services that we offer routinely, but there are those that we shall offer when we are faced to displaced persons. In conjunction with planning department and health, we ensure that when there's any disruption, we support the displaced persons. And when we try to align it to our goals, is that we are supposed to have nutrition promotion programs, which is also under the National Health Policy. We extend outreach programs to affected communities as something that we see whenever a community is affected. Tukatwalayinga machiriku twamenya tuchabana banu banganayi diary kwa child immunization betungesipatara ekaba watikaya yanganabya iyabiri bya affected isibanga chungula ngokubatolera. So twanganasera hakuhi na alinge camp so that we offer child immunization services and other services that may be offered at community level without necessarily being in health facilities. Twanganabisu twangatukeria semezero mukure hai oma community, that one will require at least us referring to the health facility. So provision of communities with water purifiers like aquasafe tabs, so that abantu ibananya meetse awane henire. So this is in regard to promoting prevention of waterborne diseases during disruptions. We conduct this during disruptions. We conduct routine risk assessments. Tukabitunumia lebya echangabya ngani chahai kandi nga twangachiite kitekera tuti in case chama happening. And this is all about ensuring quality and safety of affected persons so that it as a system you can't live without strengths and weaknesses. So our health care system has strengths. We ebika tutokesaya eribya itwangana offering a service hamabe hali kizibu kirebe kandi betu hanemu nebika tulemesaya that we shall call the weaknesses. So as part of the strengths quickly with my group, we identified that we have human resource. In case of any disruption, the human resource, the healthcare workers, we have the VHTs in the communities who are able to support us in the response. However, on the weakness side is that we are not enough. As earlier presented in the morning, you saw our staffing levels are still very, very wanting. Existence of village disaster management committees. The team are well presented to us in the Kwabialu. To now it is a committee eskim and disasters. So sikatuwa tikaya eribishangana identifying and anamabani katisebichirevi naruba we are able to discussing how they can manage it. And even the district, when it goes to respond, bakalaba through those structures so that they have a clear penetration within the community. However, on the weakness side is that abandu banu siba uti very kolesha. Sometimes they want to respond. Betu wasangana siba uti gumboots. They don't have gloves. Hamabe mudslide. Chitakacha matero kwa bandu. Eribi high kandu wasangana tuwabiri increasing our exposure to other risks. Bahamba kwa bandu wani mulomo msasi ke strombarisha glove. Betu habo huma and the togetherness and brotherhood that we have. Omduni riskingere hambo kwa mduni ani mulomo msasi with bare hands. So that's one of the weaknesses within the system. Existence of acting reporting pathways. A community yetu yabiriminya na health workers sabasawa nesi chindu cha mabya. This is how we report. Tunasi abe reporting aku. Tuanganane rihondano mwatsi wanganabura chairman LOC1 we chairman LOC3. We know who is important when it comes to responding to certain disruptions that affect us. However, tuwete chitsebu in the technology ya sire abantu sibali baende bakikiriria eri shiftinga. Nowadays people are using too much of WhatsApp and people feel they have reported. They deposit something on the WhatsApp group or someone's WhatsApp. Opening at the end of the day, you find the information, a response here delayed because of the channel that was used. So if all of us embrace it, we shall be in position to respond. We also have existence of health unit management committees that link the healthcare system to the community. So every color of machalu, because nganai kwa hospital, never kwa hospital, our member by the committee, bakaba num college, banum sensitizing the community. How do lower level health centers contribute to secondary care service delivery? One is that they provide health education to communities on disease prevention and health promotion during disruptions. Bakaba nimusumesha bandu okobya batolere bakola ne batolere bayirenda in case echindu cha mabya kwiheri chitanga erevya. Provision of water purifiers to improve the quality of drinking water. Tukahayi famabiriwa ne district ikatuhanga esha tablets esha wangate kwa maetse olo chinire akavya inyangana tokere nyibwa kwerikolesiwa. The facilities, the staff in facilities together with the community, they help us to reach out to the communities. Additional outreaches chenongalu na bili chibwa tukayendai tutosongere rikola cheriminize ngabandu. Referral of complicated cases sutuli honerane bya tutetwanga toka. We make sure that we escalate them to the next higher level of care. Then participation in mass vaccination programs. Panganasanga ne twabiribane chitsebu ichaite siwa and abandu tukende college tukende batsireke tukana bananga floods, and the end result twaisanga twabire banange cholera outbreak. Out of that netota to planning for a massive vaccination of the community, immunization. So our healthcare centers which are near those points are very supportive in such arrangements. Notification of the sub-county disaster management committees. When a disaster happens in the community, our health workers as first responders, because when the community picks up a person, they report to the facility which is nearby to provide first aid. Bakabe ebanganatisa reporting authority hawole nditoma bana chindu cheno twanga chamba truth. I'm about to finish. How do lower level health centers contribute to secondary health care? They face challenges, and these are some of the challenges that they face in contributing to secondary care. Inadequate medicines and medical supplies. Utukomunene kwa sangane wabukuletera omulwere kwikazuality betsu wetineberi kolachi neberi mukolesha ne first aid yayanga nakola manere omundu. So that is one of the challenges. So facilities shetu shesipatala shetu utukomunene, or sometimes you find a water connection system iya broken. Se utenga maetse ikarila ingango kwa maetse awe tap piped water only. So it becomes a very big challenge for them to respond to cases when the water connection system, like any other system, even electricity, sometimes for those facilities without solars, they are struggling to provide care. Low acceptance of communities to take on sensitization messages. Twanganawa to call a chirebe to respond to this, like boiled water, drinking water. Then the person tells you boiled drinking water smells with it has smoke in it, so it smells bad. Narabandu bana eba continuing and erinywa amaetse awate safe for drinking, so it affects us. Refusal to eat greens to improve their health. Omundina kuratiyo amabiriye dodo ikamla bomwanda ebana, but that is one of the ways for us we respond to. The poverty index of the communities, abandu betu nibanakwa bakakwa. You may find something to buy for you to get care at the facility. For instance, they gave us an example of narrator sabomondo taule jag eritere noko spatara na maetse beitu akende ore jage teke meritere ichabinichi enichitsevu. They can't even afford to buy a jar where they can mix ORS. What are strategies could improve the integration of the secondary care services into the national system? We are saying continuous sensitization of communities on preparedness and response to any disruptions. Abandu tubaso meseye bangabya ibanasi echerekola in case chindu chamasa. All disruptions due to extreme weather events need to be integrated within the reporting tools. Data reporting. Wamabulya hanu kabura omundoiri in charge of disaster management will take the quick analysis of what has happened, all those events. The person will first read all the reports that have been written. There is no database at all that can help us to quickly analyze and we get the picture of what has happened. Strengthen and functionalize level disaster management committees. To sasasi hamani sha disaster management committees siro kwa vyalo tuminye tisinimu mitinga. They are able to identify the threats within their communities and also sensitize their communities on the right practices. Strengthen multi-sectoral collaboration in relation to preparedness and response to disruptions. It will be to nimukola haima with everyone: environment, production, health, community, departments, the partners. It will see we mix so that we can be able to respond. Community engagement and involvement in ensuring continuity of essential services. Hanem itwatunge chitsebu kanda have hanabandu abakaida obuwa teacher betisibesa tokerendo kwa spatara. We can identify those cases and then we make care plans. Telebenga twangana tukabatara mobiles, take medicines to them when they are at their homes. Then strengthen data sharing for easy communication and coordination. I've already hinted on that. Set up bylaws in regard to responding to disruptions. Hamaba nike hii stance abandu ba maana echatuleta ekyatuleta ng'ekigende tuyamba to respond to what has come out following the extreme weather events. It was to know how to hold them accountable ng'esystem yatukakoleramu. Lastly is how can collaboration and communication between different levels of care be strengthened. And here we said we can hold regular meetings to share information on extreme weather events. We discuss what are these. We do like traumatic risk assessment yetu akolire. Itwatwangana informing our stakeholders of what our findings are so that they are updated. Periodic mentorships of healthcare workers on disaster preparedness and response. We do transfers of these healthcare workers and their hotspot areas which are prone to these disruptions. So Anganiha Omdeka Sandara, who has the knowledge on how they always respond, but we need to ensure that we continuously go there so that if there are new people on board, we ensure that they have the knowledge on how to respond to these cases. Electronic sharing of precise and straightforward information. Sometimes Omdaka kutumera information, but interpreting people just post something, you struggle to get even the location of where it has happened. So want people to share precise and interpretable information so that it can trigger quick response. Conduct impact assessments towards identified disruptions. We are faced with challenges, we implement interventions, but at the end of the day, we don't go back to see if our intervention worked and how well did it work, so that we provide feedback on what worked and what did not work, so that next time it happens elsewhere, we know what to avoid. Thank you so much. I will ask my colleagues to stand up for recognition. I did this on your behalf.
A big hand clap for the colleagues from the Group 1. Thank you so much, Constantine, for those presentations. Group number 2, is it? Group 3. All right. Number 2? Number 2 coming. Sir, you're most welcome. Constantine, thank you so much. Yeah. So, omukulinya namu teka ku computer. Mwasinja kutsiba vanishe. Mwasinja kutsiba londa. Omwat tunasema leo.
Yes. I want to welcome everyone, but members of the group, you can wave to the house because I have to stand here on your behalf. Allow me briefly extend to you our products. So I will be brief. For those who don't know me, my name is Isaac. I'm going to take you through what we discussed. I have to stand here. Is that okay? Well, we were supposed to come up with the extreme weather events that have had the most significant impact in line with health systems in the district. And this is what the colleagues came up with. Floods. It is very rampant, very on record that floods have really caused havoc and affected the health systems in the district. I may not read one by one, but I will just keep picking some key points. We have seen the wash facilities being disrupted or affected. Those who remember Kilembe history, someone has mentioned it, I will not repeat. People have been forced to move. In the language where I come from, we call it climate mobility. The forced displacement due to the impacts of climate change. So when floods hit your area, you are forced to move. And then there is also some points are repeated, I can see. Then there is also, we get a challenge with crops leading to poor nutrition when it comes to health, the food chain. And when you connect the mothers or people who need the food that they deserve to balance the nutrition, so you find there is a problem with this. There is also inaccessibility to health facilities. People are cut off. You will die in the village because you cannot access the facility. Maybe the road has been cut off and other facilities have been destroyed. There is also hail or windstorms. The continuation, number 2. There is also malnutrition that will be caused because food is destroyed. There is also physical injuries. When mudslides, hailstorms come, sometimes in my village, the roof, the wall, too much wind has really destroyed a lot of infrastructures, leading to injuries. There is also a challenge of reproductive health. There is also destruction of health facilities. In my village, those who know Isule, my next village, doctor, people have suffered. And when it is captured here, I know maybe the medicine is going to come. I'm trying to be faster so that I manage time. Landslides and mudslides, especially the roads. Roads are cut off, loss of lives, crops are destroyed, and other infrastructures, but also there is pollution that goes in the water sources, the contamination in the water sources. Our rivers, when floods have come, when land has slided, then there is a lot of runoff that end up into the river, and yet tomorrow you are going to use the same water source. So this is also one of the types that we saw. We also have dry spells. Others call it drought. Drought, if you talk about it, you will spend the whole day, but water sources are affected. They dry up, yet health systems need the water to continue services. So there is also multiplication of vector-carrying diseases leading to illnesses. So some vectors are favored in this condition of hotness. Because when there is a lot of floods, maybe coldness, some vectors, the scientists in the health sector know it very much better. But we understand that there is a lot of multiplication of these vectors that carry diseases. That was question number 1. Question number 2 was also looking at the historical events or environmental factors that have shaped or defined or named the prevalence of extreme weather events in the district. So we tried, actually the group 2 had the most complicated questions. This question was one of the most complicated. But the good news is that we had technocrats. The madams were there and they were simplifying it for us. So we are looking at 3 major components of the question: the historical events or environmental factors, the prevalence of these weather events. We combined population increase causing pressure to the availability space and the resources. Thus, there is multiplication of... So, you find out that in this point number 1, the prevalence is based to the history of the population of people, where people will increase, demand will increase, and the natural resources will also be put under pressure. That is just simple as that. There is also demand for resources to accommodate human needs that have induced the weather events. So too much demand. There is also acceleration of weather events. For example, on point number 2, if people want fuel wood, that's an example, they will cut more trees. And more trees being cut will lead to the open environment. The land is left bare, and the weather extremes, the temperatures will increase, and dry spells will come. So there is also destruction of fragile ecosystems. The spelling of eco is different. The secretary made a mistake there. So ecosystems, this one is not there. It is just one word. We see that when historically our land was virgin, we had a lot of forests. But the former doctor, I met him, is still struggling now to replace the riparian environments that were destroyed, the accumulation of populations. Human activities like settlement and cultivation of crops in wetlands have really exacerbated the prevalence of extreme weather events. There is also over-cultivation. Someone cannot spare the land because the population has increased. You have to produce time and again. Destruction of forest cover due to deforestation and land degradation is also one of the points out of this question. What comes out then? We see that high temperatures will come up, especially leading to, for those who have not gone up there, our friends who don't live here in Kasese, we have a mountain called Rwenzori. I've been to the snow line. Doctor, you know, doctor is my friend. We have been there. So we have the snows, we have the glaciers. But now, because the history continues telling us what we need to do, there is also the temperatures resulting from different activities, historical activities, human-led, human-induced. We talked about the eye care, the indigenous knowledge of conserving the environment. Historically, in the past, our fathers used it to conserve and protect the environment. Even going to a wetland or a swamp to cut reeds would mean something culturally. Going to Nyabitaba up there to cut trees, hunting animals, all these were regulated. We had traditional segments and words back to the conservation of these ecosystems. But now, of current, extreme weather events have increased because the eye care has been ignored. There is also unsustainable approaches of conservation of this environment, which has led to the introduction of exotic trees, different types of fish in our native fish, and all these have really, historically have changed the trend. There is also another question, which is how the frequency and intensity of these EWES have evolved over time in Kasese. I told you we had the most interesting questions. If you've not passed P1 very well, you cannot pass this question. If you didn't finish P1 very well, I know time is running, but I'm left with, colleague used a lot of time. So let me wind up. The frequency and the intensity was all about the qualitative and the quantitative in numbers, showing how the shifts and changes in the trend, especially when you're approaching these weather, the extreme weather events. So we looked at the MAM. For example, the March, April, May, that period has been shifted. You find now that the cropping season has shifted to April. Yet culturally we are supposed to do the farming cultivation like putting crops in the soil starting from 15 in the March of May, or I mean March. But even rain favored us to see that things work well. So I know you've been reading all this. I will not repeat them. Interestingly, there is a persistent shift of planting seasons for over 5 years from March to April, which has been shifting, and we don't know where we are heading to. And due to the short season, maturing crops have dried up, leading to disruptions of systems, even health systems. What are the root causes? Number one, this is a very, very cheap question. If I don't get 100% out of this, you chase me out of your school. The root causes, but also you have to align them with the weather events, extreme weather events. So poor farming is one of them, especially farmers. And you see, I've quoted methane gas as one of the greenhouse gases that lead to the global warming. So this is one of them. There is also establishment of unregulated small-scale factories and industries. A lot of fumes, unwanted pollutants into the atmosphere are also bringing weather events to really be too much. There is also poor settlement. The district does not regulate, or even the government. Someone is even settling in a fragile ecosystem, in a wetland, in the riverbank. I've seen this with my eyes, I've seen this. And because now the law is that land belongs to the citizens, I will go and put my house because I have a share of the wetland, so it is okay. So this is one of the root causes. So the other environment unfriendly activities like vegetation clearance, deforestation, and all that. As I go to the last question, mindset change. The I don't care attitude is a very, very big factor, root cause that leads to these extreme weather events. Because people don't have the idea, they think everything is okay. They don't have the information. So it's the point on its own. Erratic rainfall patterns and others. Lastly, how local communities traditionally responded to these events, and how have these responses changed over time? When I was born, we used to walk 1 kilometer to get water from the well in my village. But this time round, we walked 25 kilometers or around 17, 19 to access water. So, traditionally, we are saying let awareness, sensitization, because information has to continue to the next generation, especially the eye care. I come from a cultural setting. So, this is a traditional but also a modern way of approaching this problem. The good farming practices have to come in place. These days, finding trenches in your land, go to Kavale maybe where the landscape is steep, is when you can find trenches. But in our gardens here, our traditional ways of doing farming have changed. Then tree planting. Fathers are still planting trees. Like in my home, if you reach there and you don't find any tree, please arrest me. So I have continuously taken up the mantle of the forefathers that they used to do, especially the indigenous trees, the bark trees, and other species of trees. This practice of rainwater harvesting, because our fathers believed that natural rainfall was very pure. So this is one of the traditional ways. You will find someone putting a small gutter on the roof and collect that water, which needs to be amplified and reinvented in the modern setting, like provision of water collecting tanks and so on and so forth. So there is also evacuation centers. Whenever catastrophes would come, disasters would come, and then our parents would take us to a safe place. But now it is also going on with a lot of issues. And there is also how have these responses changed over time. So in summary, there is a high increase in adaptation and adaptation. You adopt and you adapt to. So when you do the adaptation and adaptation, then you are trying to change the weather patterns or even live with them to occur. Thank you, members, for listening.
Friends, let's give him another round of applause. He has made justice to the question which was posed to him, but since time is not our best friend, I just want to take this on and privilege to invite the Prof. Just make a remark about the closing highlights, and then we see how to go home. Otherwise, it's getting late.
Okay, thank you, Arafat. Ladies and gentlemen, I think can agree that we have had quite a long day, but in the analysis of the team, it has been a very productive day. I want us to give a round of applause for ourselves, because it has indeed been very productive. We started off with presentations. From those presentations, we went into stakeholder mapping and then broke up into the groups. And from the presentations that we have had this afternoon, we have not spent much time on them, but we can see that the information that the various groups have presented is very rich information. The onus is now on the team to synthesize this information that has been presented, including transcribing the other information that has come through the presentations. So once that is done, we then expect that we can develop key points to share not only with you, but also share across the countries that I talked about. And the next step, of course, is
as Secretary of Social Services. First of all, I want to apologize for coming in slightly late. We had a busy day. Ministry of Health gave us an X-ray machine. We had to receive it in the morning. We had education funders. Then there was this social disaster of the 2,000 people camped at the RDC's office. We have had a long day. The Minister of State for Lands is in the district, and the State Minister for ICT. So I had to usher them in first before I came in, because the district boss wasn't in the district. Ladies and gentlemen, I want first of all to join me thank University of Science and Technology. Can we give a round of applause? That is not enough. You are selfish. What? Thank you very much. The reason why I'm thanking them, they have demonstrated, Professor and your team, you have demonstrated the purpose of a university in a community. When I was at school, at higher levels of schooling, my professor told me, or told our class, that a university is relevant when it shapes interventions to mitigate challenges of the community. And that's exactly what Mbarara University is doing. We want to thank you, Mbarara University, for the collaboration. We have enjoyed a very good collaboration at our University of Science and Technology. You have heard what the DHO is saying. They have been around and they will continue being around. So we want to thank them for the Reshape project. I want to pledge on behalf of Kasese District Local Government our continuous support, both the technical people and the political leaders. I can see my political friends, Chairperson Bulembia Division, Chairperson Karsandara. I think next time we should invite the one of Chondo. Chondo Chairperson, because Chondo, is he here? Juvenile Muke is not here. But Chondo is also prone. You know, last year and the other year, Chondo Sub-County and Charumba have also come up seriously. I want to say that, yes, the weather events are true. It is very true. Kasese, we are facing those extremes. The dry spells, the landslides. Just yesterday we were burying a police officer, you know. May his soul rest in eternity. When the wind came, strong wind came, the eucalyptus tree falls on his unipod and he meets his death. So it is true, extreme weather events are very real and disastrous. Therefore, I want to thank your participation this morning. You first of all listened to the presentations, and that gave you insight now to generate the actions. I found you in the serious groups, you generated the actions, and therefore, I want to read verbatim. We have come up with practical evidence-based strategies to strengthen the health system resilience so that we can continue providing services, and we should implement those responsive strategies to arrive at integrated solutions for health resilience in our vulnerable communities. Because that is the catchword. That is the bone marrow. The actions we have brought out are intended to mitigate all that we have gone through. It is true, because of our topology, because of, could be where we are found, the lakes and rivers and other natural resources around us, could be in that accumulation or in that ecosystem, then we get those weather issues. I want to take you back. One time I went to Rukoki sub-county, we were in Buhaura, and I saw a man's house or a family on top. I don't want to call it summit, because at least summit would be a little flat. But on the tip of the mountain, with a house up there. I want to call upon our leaders, the political leaders, and even you, the health workers at various levels in your various stations. Can we be cautious? Have physical planning officers at the sub-county. But how do you build on the tip of the hill? And that even the lighted and the landslide, you know, here our mountainous areas, Mahango, Chondo, Ihano, and other areas, very prone to the thunder issues. What if there is a landslide? That man's house will be the first to roll down in the valleys. What am I saying? In our sub-counties, in our areas of jurisdiction, can we come up with the bylaws? Our group was looking at regulations, regulations and policies in existence to mitigate some of these issues so that we don't get the the EWES, those extreme weather conditions. Yes, we can come up with the bylaws, and at the end of the day, reinforce them and enforce them, so that, like he has my friend from Isule in group 2, he has been talking about people who put their houses and homes in the valleys. You find someone constructing a house in the river, almost in the river. And when it floods, he swept. And when he swept, he cries towards government. Government, what are you doing? LOCs, you are not helping us. Disaster committees, give us assistance. But you hanged yourself when you are building your home or your house in the river. I don't want to take a lot of time. I want to say that let us strengthen systems and work in that multidisciplinary approach, like you have already brought it. Work in that multi-sectoral approach, and at the end of the day, we shall overcome. And by the way, when we continue in our next steps, when we come for the second round, looking at how to have gone to implement, I know we are going to start implementing, or have started implementing. If we have not started implementation, tomorrow morning can we take off? And when we come back, we should be able to speak progress. And I believe at the end of the day, we can come up with a very big pilot scheme, a pilot project, whereby people will learn about us. Kasese, you have been prone for a long time, prone to extreme weather events. But this intervention or this project, if we supported it, if we worked for it, if we got involved, deeply involved, and if we took it to another level or different levels, then other people will be coming here to learn from us how we have overcome and how we have mitigated extreme weather conditions on health services. And it is true, when the extreme weather events come, it's the health services that are eroded. I could not believe that a river can sweep a hospital. You saw it with your naked eyes. But thank heaven, this year, the rains always come in May. I kept praying that May ends. I even tell my friends that when it is May, if it is May 15th, then we have overcome. But surprisingly, I'm seeing even rains in June. But I want to comfort you, I'm not threatening. The floods, we have been having floods in May, April, but now the June rains, don't worry. We have already overcome the floods. Lastly, I want to pledge our total support in collaborating with Mbarara University of Science and Technology, that we shall continue working with you so that this project can become a success. And I want Professor and your team, if there is another project that you can shape in another area, it may not be in the area of health and climate, but could be in education, and you are dealing with community health. There are so many issues in the community. Like here we have a lot of people committing suicide almost every week. Of people committing suicide. We have teenage pregnancy. I think we are either number 1 or number 2 in the country. Very, very alarming. So those are community issues, Professor, we have here. So if you can think of another intervention, we welcome it 100%. Then you come. We shall be there to implement, because we want to come out of dangerous issues that affect our community. Having said all this, I want to say thank you very much. And I want to take this singular opportunity to declare this interesting learning and conversation closed for God and my country.
Thank you so much, Chairman. 3 announcements. Number 1, the St. John Ambulance is announcing the resumption of the ambulance services. So for those who have been using that ambulance, they're announcing it's back. Then the number 2 announcement, on the 15th of June 2025 is World Elderly Awareness Day, and Community Aged Foundation has taken lead in organizing this. The last interesting one is that for our invited guests, as you go and have a cup of coffee or tea, you will also kindly walk in the back, and our team will be there to provide you a modest transport refund. Thank you so much.